Alrighty. Well, good afternoon, good morning, and greetings wherever you are at today. Welcome to this year's seminar workshop. This year's session is all about risk factor studies, different approaches, resources, and what data can do for you. I'm Alicia Johnson. I'm a retail food specialist based out of the Denver District Office, and I cover the state of Wyoming, as well as the Northern Counties and State Agency for Colorado. And anyone who knows me or has run into me when talking about program standards knows that while we're not supposed to play favorites, I do. Standard 9, I can't lie, it is my absolute favorite because I love data. I love it. I love what it can do for you and your programs, your departments. And while risk factor studies do take additional resources, they're resources well spent. That said, today we're going to give you plenty of food for thought for how to help you balance your study needs with available resources. But before I get too excited, because I do have a tendency to do that when talking about risk factor studies, I want to cover a few things. First, I want to apologize for my nasally voice. I'm getting over a cold, and I hope it's not too much of a distraction. So I'm going to try and keep my Kleenex breaks to a minimum, but if my puffy, Dayquil, pale face is just too much for you, I will not be offended if you throw in the chat that you want my camera off. Second, I want to take a beat and let my co-presenters have a chance to introduce themselves. I'm joined today with Mr. Justin Asbury and Ms. Catherine Del Mundo. Justin, would you take a moment and introduce yourself?
Well, hello, everyone. I am Justin Asbury. I'm a retail food specialist as well. I live in Yukon, Oklahoma. It's just west of Oklahoma City, and I work with the states of Nebraska and Oklahoma. Just before joining FDA, I worked at both the state and local levels, so I know what it's like to be out there in the trenches. So we'll hope that we can, share some very valuable information with you all today.
All right, thank you, Justin. And Catherine.
Good morning or good afternoon, everyone. Thank you all for being here. My name is Catherine Del Mundo, and like Alicia, I'm based in Denver, Colorado. I'm actually calling in from Parker, Colorado, and I assist at Arizona and California. Prior to joining FDA, I come from the beautiful island of Guam, so big shout out to the Pacific Islands. And like Alicia, I really enjoy Standard 9 risk factor study. There's a lot of value in it, and we hope that you enjoy and learn from our workshop today. That said, I'll hand it over to Alicia.
All right, thank you so much, Catherine. And later on today, we're also going to be joined by Mr. Mike Nordos, who is also a retail food specialist on our team. And he is the co-lead for our risk factor study work group and the absolute guru on our risk factor study database. So a special treat for all of you later on. And I also want to acknowledge some key people that are helping us out in the background today. We could not be pulling off this workshop without them. So a huge thanks to NACHO and Conference Direct, who have been instrumental in making this entire week happen along with this workshop. They've been providing tech support, helping run the platform, and a variety of other support functions. So a huge thank you to them. On a technology note, I would encourage you to try connecting in Zoom if you are having difficulty with Pathable. There should be a little link at the bottom of your window or at the top of the chat in the theater mode. That said, you can continue in Pathable, but if you experience some issues, just consider switching over. The last person that I would like to give a shout out to is Carolyn White. She is also a retail food specialist on our team, and she is based in Kansas City. And she's going to be watching the chat for us throughout our sessions today so that we can focus on the delivery of the material. So if you have questions as you go along, please drop them into that Pathable chat. Carolyn's going to work through, answer them, but please recognize that we have a ton of people on the line today. So if for some reason she misses your question, it's nothing personal, but rest assured, we are actually going to grab the chat after our session today, and we're going to put together a frequently asked questions document that we'll post on the workshop page. That way, everyone gets questions answered, and we're able to moderate what we're able to tackle today. The other thing I want to throw out there, and this will become very clear as we go through the workshop, some of the questions are not easily answered in chat. Some of them require further discussion. So for example, if you throw in the chat, I have 3 staff members, which study design should I use? That is a great question, but one that needs some additional information about your resources, your staffing, your timeframes, as well as other components. So if Carolyn tells you that is a great question for your retail food specialist, she's not brushing you off. What she's telling you is That amazing question deserves a one-on-one. Let's go ahead and dive on into our material today. And I want to start off with getting us acquainted with how this workshop's going to work. So first off, let's go ahead and talk about what all we're going to cover today. This is a jam-packed, comprehensive session, and we're covering all aspects in just a few hours' time. To give you a little bit of perspective, this is a distilled course from something that was delivered over the span of 2 days with some jurisdictions earlier this year. So we're going to go over not only the benefits of doing a risk factor study, but we're also going to give you some details, some considerations that go into tackling one. We're going to cover many aspects of study design, touching upon the 2 main approaches. We're going to give you some pros and cons of each, as well as walk you through how to sample, come up with your sample list. Then we're going to cover some resources that we use at FDA, including our data collection form, our marking instructions. And we're doing this not because you have to use them, but because they're a really good place to start when trying to figure out your approach. As you're going to find out, we actually have a lot of tools available to you that you can either adopt as is, adapt to meet your needs, or simply use for inspiration to build the framework that's going to work best for you. Next, we're going to cover how to do a data collection. This section is going to be applicable whether you're actually doing a data collection or whether you're working it into a risk-based inspection approach. Then we're going to move on to some optional assessments that you might consider to add some dimensions to your study and your findings. And then we're going to move on to talk about quality assurance and how that's going to weave throughout your entire study from start to finish. And we're going to wrap up the main part of the workshop with some data analysis tips. Then at the end, we're turning it over to Mike to do that wonderful retail risk factor study database demonstration. So as you can imagine, we're going to work through things very quickly, understanding we also have a very diverse audience of field support and management staff, people who are experienced and here just to get a refresher, those who've never done it before and are trying to figure out how to get started. So there may be moments when we might clip through things a little faster than you'd like, or maybe we linger in an area where you're comfortable. Just be aware we're trying to balance audience needs with time and platform constraints. Now that said, I know, a ton to cover. But don't worry, we are going to try and make this as interactive as possible within the confines of time and platform. So we are going to have some discussion questions, chances for you guys to weigh in the Passable chat, as well as some knowledge text to make sure we're all in the same place. We're going to have some very short activities and examples, and like I said, that database demonstration at the end. So what we'd like to cover today, we want to make sure that everyone understands the purpose of a risk factor study, the required elements of Standard 9, and some optional study elements that they can work in. We're also going to walk you through study design options and the support tools that we have at FDA, including our marking instructions, data collection form, and our study approach. We want you to be able to understand how to conduct a data collection. We'll walk you through the analysis and quality assurance portions, and then again, be familiar with that risk factor study database. Let's set the stage. We're talking about risk factor studies today, and I know a lot of us are here because they're an important element of Standard 9. But first, let's take a step back. We're here with the program standards. And again, these are things that were developed with FDA, along with folks just like you, with the goal of establishing best practices for retail regulatory programs and a framework for continuous quality improvement. And a big part of that is measuring success and reducing the occurrence of risk factors, which is what Standard 9 is all about. And it's done through not only the data collection piece, but also targeted intervention strategies for priorities that are identified. There are a lot of moving parts with Standard 9. The first part is you got to get the data for the facility categories under your purview. Then you analyze that data, you write a very brief report, and then you do something with that data. You develop, you implement a targeted intervention strategy, and then you update your study at least once every 60 months to not only evaluate your intervention, but see how things are going. Because the ultimate goal of Standard 9 is to track trends over time. So bottom line, the risk factor study is a public health metric. While we can't measure the lives saved or the illnesses that never happened because of the good work that we and our industry partners do, we can measure the things that are happening in our community and start doing our best to take corrective action. And of course, a data-driven approach, monitoring those trends over time, is really kind of the crux of continuous quality improvement. And yes, I know it's a lot of work. I've been there, but it's time well spent. And yes, you're going to be working on Standard 9, but I really want folks to realize that doing a risk factor study goes well beyond the program standards. There are other benefits to you. For example, you can use this data to assess strengths and gaps in your program services. You can use it to formulate good food safety policies, new initiatives. You can use it to plan your work plan priorities or allocate resources better. And don't forget, risk factor studies can tie to other department initiatives, such as FAB accreditation. So anybody who's looked at FAB knows that data-driven approaches, continuous quality improvement, they're all a core piece of FAB accreditation. Standard 9 fits in really well. But I think the biggest additional thing that a risk factor study can bring you is it gives you data to tell your public health story, paint that public health picture when discussing with leaders and stakeholders. It can help you support requests for additional resources. It can help you support policy changes. But all in all, it really shows the value and impact of your work. So some key take homes. Yes, we're going to cover a lot today. Yes, a risk factor study can provide key metrics to your program. And yeah, there are several components of Standard 9. The first few we're actually going to spend time on today. And that's the study, gathering that data, analyzing it appropriately, doing a report, and then identifying the things that you're going to need to spend for the intervention strategy. So with that, I want to jump into our first core piece of the workshop today, and that's about study design. And as I mentioned in the standard, there are really two main approaches. There's using inspection data, and there's the full standalone data collection, where you have trained data collectors go out to randomly selected establishments and make key observations. We're going to talk about both approaches in this section, the pros and cons of each, to give you some food for thought when deciding what works best for you. And then we're going to also wrap up with a little bit of discussion for those folks who are trying to fit a regulatory approach in with their study design and some key things that they're going to want to take into consideration. But before we talk about these approaches, we'd be remiss if we didn't talk about the importance of planning, and we're all in public health, so we know why planning is key. And while Standard 9 does not specify planning requirements, we are wanting to make some recommendations for you today. First and foremost, when you're planning on tackling a risk factor study, and any jurisdiction that's reached out to me, if they don't tell me their study goals right off the bat, I'll ask them, what is it that you want to achieve with your risk factor study? Are there key questions that you want your data to answer? If you're just checking the box for Standard 9, great, we know exactly where to go. But if you're wanting to go beyond that and see if people are following local ordinances, or if there are food safety practices that are more challenging in certain facilities, or maybe, teaser trailer, you want to see if a strong food safety management system may tie to better control of risk factors, we want to know those in advance, because guess what? Your study design is going to be driven by your study goals. Once you outline your goals, you're going to want to think about how many establishments you have, how you can pull that inventory. So you're going to want to take a moment, pull those, and in just a little bit, we're going to talk about how to organize those so that it fits the risk factor study model and will help you meet Standard 9. Then after you know how many facilities you have, start thinking about roles, needed resources, what you have, what you're going to need, because that's also going to factor into your decision. How many trained staff members do you have? Have you had a lot of turnover? Do you have high quality inspection data that you can easily pull from an inspection database? Or do you need additional support? Little plug here, keep in mind, we do have the Retail Flexible Funding Model portal open until October 12th, and getting funding and support to complete a risk factor study is definitely on the table. Lastly, something that folks don't realize is that you don't have to bite this all off at one chew. You can actually space things out in a way that is a collection schedule that's going to fit your resources, your work planning needs. So this seems a lot more achievable. We'll talk about how to do that in a little bit. And lastly, there may be some data collection policies, like marking instructions, that you might want to plan out and have incorporated into your study. So let's talk about those industry segments in Standard 9. So Standard 9 requires that you assess all 5 foodborne illness risk factors in 4 industry segments for the ones under your purview. I'll come back to that in just a second. The 4 categories you have to study are healthcare, including hospitals and long-term care, your K through 12 schools, your full service and fast food restaurants, and retail food stores with delis. Now that said, while these may seem straightforward, for some jurisdictions, they may need to define each of these. Maybe there's some licensing types that they're not sure how it fits into the industry segments. You can define these based on what you have, but the key is to consistently divide up the facilities you regulate into these meaningful groups and make sure that you're being consistent between study and study. Now, I don't want you to think that you're limited to just these 4. If you are a jurisdiction who wants to explore, let's say, mobiles or temporary food establishments, you are welcome to add additional industry segments to this that are of interest to your jurisdiction. These are just the bare minimums. But I want to be really clear about something, and I mentioned this just briefly a moment ago, under your purview. If you're looking at this list and you're going, gosh, our Department of Health doesn't regulate retail food stores, that's our State Department of Agriculture, you do not have to include the facilities that you don't regulate in your study. You want to focus on the ones that are under your regulatory authority. So I want to talk briefly about risk categories, and this isn't required by Standard 9, but if you're going to do a separate data collection, this could be something you want to consider. So as part of Standard 3, it requires that you assign different risk categories for each establishment based on what they're doing in their food flows. So for example, on our chart on the screen, it's just a segment of what our example is in the Annex 5 of the Food Code. What we're showing is that lower risk establishments with risk category 1 are places that really don't have a lot of risk factors at play. They're places that do like packaged TCS food. Maybe they're a coffee shop. Maybe they're a convenience store with like hot dogs on a roller grill. So there's not really a lot of risk factors at play. Then we have risk category 2. Those are our more limited menus, maybe quick assemble and serve or quick cook and serve. But risk category 3, which is just below this table here outside of our excerpt, are going to be our more complex food operations. So places that are cooking, cooling, reheating, and then serving. So those with more complex food operations, those with moderate food operations, so our 2s and 3s, we're going to be able to observe more risk factors at play in those facilities. So if you're going to do a separate data collection, you really do want to maximize your ability to observe risk factors at play. So if you limit your study to the risk categories 2s and 3s, you're going to be able to maximize those. And that's going to help you with your data analysis and more robustness to your study. So in summary, you have to include the facility categories that you regulate, right? Those 4 facility categories. Go ahead and define those in a way that makes sense for your structure, be consistent with the categorization, and of course you may include more categories as far as facility types, or you may explore risk categories. Now I want to cover the collection schedule that I mentioned a little bit ago. So for those of you who are going, this is great, we're going to tear off the Band-Aid and we're going to knock this out in a year, good for you. If that works for you, that is definitely in compliance with Standard 9. So you're going to be in the left-hand column where you're going to do a single collection, you're going to knock it out in a year, and then you're just going to repeat that every 60 months. However, for those of you who are thinking, it's going to make more sense for us to pace ourselves, break things up over time, that's okay too. On the right-hand side where it has a revolving collection schedule, you see some examples of how you can break this up to be a little bit more easy to identify. So, for example, you could knock out your restaurant data collection in year 1, take year 2 off to do some data analysis and prep for your subsequent data collections. And then in year 3, knock out healthcare and schools. Year 4, tackle your retail food stores, and take your last year to do your further analysis, write your reports, and then go ahead and figure out that intervention strategy. And then you just repeat that cycle the same way every 60 months. So with the data collection approach, the next few slides are going to be very specific to this approach, and I just want to state that right off the bat to make sure that people are really clear so they don't get confused when we switch to the inspection approach. But the data collection approach is really what we do at FDA. We do separate non-regulatory visits that focus on the observation of risk factors. And with this approach, we can focus not only on the needs of the data collection without competing priorities, but we can also limit the collection to train staff members to ensure uniformity. And since it would not be possible for us to visit every single establishment in the United States for our observation, our study uses random sampling to get a good estimate of the occurrence of risk factors across the population. And the same thing can hold true for your jurisdiction. If you do separate data collections, it doesn't mean that you need to do a data collection in every single establishment unless that's the way that you choose to do it. You too can use estimates to get the occurrence of risk factors in your establishments. So data collection basics. It's observational, they're non-regulatory, they're unannounced. They really focus on risk factors and specific areas of interest that you want to add to your study. It uses a tailored data collection tool, or if you choose, you can use something that mirrors your inspection tool. But really important, you got to use the conventions in, out, NO, and NA. That is not only a requirement in Standard 9, but if you don't use this, it's actually going to skew your data, as we're going to talk about a little bit later on today. Now with data collections, again, you don't need to do a separate data collection in every single facility unless you choose to. You can actually estimate what's going on using statistical sampling, and that means that we need to have a random sample, and we're going to talk about primary and substitute lists. But first, and this is not just to indulge me because I love math, we need to talk a little bit about statistics, and I promise you, for those of you who are not super crazy about math, I'm going to make this as palatable as possible. And I do need to acknowledge a big elephant in the room. When you're talking about sampling, yes, the more accurate that you want to be, the larger the sample size and the more resources it will take. But to understand really what underpins the sample size, we need to talk about confidence levels and margins of error. And I want to start talking with confidence level. So you may hear people say, you know, I'm 95% sure that I'm right. Well, in statistics, there's a very specific meaning behind that statement. Your confidence expresses how sure you are that your sample data captured the population value. Now, remember, when we do statistical sampling, we're trying to estimate what's going on so we don't have to survey the entire population. Additionally, when we're talking about sampling, you want to be confident that if someone else repeated your study, they would get close to the same result. So in a nutshell, we want to be confident that our sample is representative, it catches what we need it to, and that our results are repeatable. And if you're a visual person, you can actually see how this works on the graph. So the graph shows a range for 100 repeated samples with a 95% confidence level, and it shows the minimum on one end and the maximum on the other. The blue bars capture the population value, which is actually shown in the dotted line down the middle. So that's the value we're actually trying to estimate with each of these samples. And you'll notice there are 5 little red bars that don't touch or cross that dotted line. They don't capture the population value. And so what you're seeing there is that when you use a 95% confidence level, if you repeated the study 100 times, you'd expect that 95 of those samples would capture the population value and 5 of them would not. If we did this with a 90% confidence level, you'd expect 90 blue bars and 10 red ones. Now let's talk margin of error, which you might hear as plus or minus X%. The margin of error is very closely related to the confidence interval, and your margin of error is how close you want your estimated value to be from the real value. The closer you want to be, the smaller your margin of error. On the chart, what you're seeing, all those little black dots are the sample means for all the sample ranges shown. And again, the dotted line is the population mean that we're trying to get a hold of, we're trying to estimate. The margin of error is really the minimum and the maximum boundaries, which you're seeing shown by those solid lines on either side. They're really the boundaries. And so if you want a smaller margin of error, you want your values to be closer, right, to that population value. Those 2 bars would move in, smaller margin of error, and of course, those black dots would get closer and closer. So let's put these 2 concepts together. Let's say we wanted to do a study that estimated weight in a population, and we want to use a 95% confidence level plus or minus 5%, and we got a sample mean of 175 pounds. What that means is that we are 95% sure that the population mean is within 5% of 175 pounds. And the sample size that we need to use to get that estimated average would be dependent on the original population size, our chosen confidence level, and margin of error. So I want to go ahead and take a moment to show how these elements affect the sample size. So let's go ahead and walk through a couple scenarios for a jurisdiction with, let's say, 1,000 restaurants. Note that the numbers shown in the sample size column would be different if we had 2,000 restaurants or 500 restaurants. So it is based on the population metric as well. So as you can see, there are a variety of sample sizes that you can get. And at FDA, we use a 95% confidence level plus or minus 5%. And we recommend that to you. And it's a perfectly reasonable amount for your risk factor study. You do not need a higher level of confidence or a tighter margin of error unless you choose to do that. And if you notice, particularly with a change in margin of error, you can get a drastically larger sample size depending on what you choose. Now, if you're looking at this and you're thinking, oh my goodness, that's still a lot with a 95% plus or minus 5 for us to knock out, you can do a lower confidence level and a wider margin of error, But we caution you, while a standard 9 doesn't say you can't go lower, just be cognizant that the lower your confidence level, the wider the margin of error, the less representative your sample could be, and the harder it may be for you to pinpoint interventions or track those changes over time, which is really kind of the core concept of standard 9. So I want to touch base on some take-homes for sample size. With data collections, you want to make sure that you get a level of confidence, your desired accuracy. Again, we recommend that 95% confidence level, plus or minus 5%. Something that I didn't mention, but is really important. After you divide up your establishments and you're looking at the number of establishments per industry segment, you may notice that some segments don't have that many facilities in them. If you have a segment that's, let's say, less than 30, skip the statistical sample and just do them all. Because if you actually run the sample size calculator, you're probably going to get close to the full population anyway. And the other great thing is that you don't have to be super savvy about statistics to figure out your sample size. Once you've decided on your confidence level and margin of error, there are plenty of online resources that you can use. And if you go to our main workshop page, we actually have several links on that page that you can use and play around with to see how that works for you. I'm going to go ahead and give you a couple of examples of how one of those online calculators works. So in this case, the one that you're seeing on your screen, I'm going to continue that example with 1,000 restaurants. And we're going to start with a confidence level of 95% plus or minus 5. And as you notice, you just plug in the confidence level with the drop-down box, type in your margin of error, and enter the population size. Go ahead and leave the population proportion at 50%, and then hit calculate. And the sample size simply pops up at the top. It's very easy to do. I'm going to show you a second example here. In this case, we have 500 restaurants. We're looking at a 90% confidence level with a 10% margin of error. We plug those in, calculate, shows us a sample size of 61. So once you've established your sample size for your data collection, it's time to get your random sample. And this doesn't have to be really complicated either. But the first thing is you have to make sure that you have an accurate, curated inventory. So that means places are assigned to the correct facility type and eligible facilities are removed. If you factored in your risk categories, make sure that those are correct. And an easy way to handle this is to simply drop your establishments into Excel, alphabetize, and then you're going to do a couple things. First, save your master list. Save it. It's very important that you hang on to that. Then you save another copy of that master list as primary, save another copy as either your secondary or your backup list. Then you're going to use a random number generator to get a list of numbers that you're going to use to match to the row numbers on your Excel sheet. You're going to highlight the establishments in each of the selected rows. Once you've highlighted all of the numbers that came from the random number generator, you'll delete all the unhighlighted ones. And now you have a sample list. And you'll simply repeat that process for a substitute list and for all of your industry segments. And I wanted to take a moment and show you just how easy some of these online random number generators are. And again, we have links to resources on our main workshop page that you can look at. In this one, again, I'm continuing that example of 1,000 restaurants in total, and we are looking at a 95% plus or minus 5%, which if you remember again, gave us a sample size of 278. So at randomizer.org, all I needed to do was put in that I needed 278 numbers, and my number range was 1 to 1,000 because I had 1,000 total establishments. And then I hit run, and a little box will pop up. And it'll give you a list of 278 numbers, which you can then match to those row numbers. It's really quick and very simple. All right, so if you do decide to go the route of a data collection, at FDA, we assign an equal number of facilities to each collector for the most part. And you're welcome to do that, providing that you do not lose the integrity of your sample. So what I'm meaning is, after you get your sample, if you notice that, let's say there are 20 facilities in data collector A's area, and you have only 10 in data collector B's area, you can't just pull 10 off of A's list and then shove another 5 onto B. So you got to be very cognizant of the integrity of your statistical sample. There could be other ways that maybe you shuffle things and assign it, and that's completely fine, but make sure that you maintain the integrity of your random sample. The other thing is to remind data collectors that when they're going out there, verify the facility, verify the risk category if you chose to use that, to make sure that they're actually a part of the correct collection. Use establishments on your backup list as needed. Like, let's say a data collector shows up and the facility is closed. Make sure that they know to go to the substitute list, go down in order, and pick a backup facility to then replace that. That way you don't need to worry about oversampling, but you're still making sure that you're hitting the correct number of establishments for your chosen confidence level and margin of error. Once all your facilities are ironed out, I strongly encourage you to provide training. Training is not only a big piece of data collection, but it's a key quality assurance element as well. So you want to make sure your data collectors not only come in to your data collection with the right skills. It doesn't mean that they have to be standardized. We recommend it. Standard 9 does not require it, but we do encourage you to use data collectors that have at least completed steps 1 through 3 of standard 2. That way they have a good basis for field training, and they have the knowledge to then take on any additional training needed that's specific to your data collection. If you're concerned, you can also do joint field training with folks in the middle of the data collection. And if you're using a separate data collection form, a tool, or a different database than what they're used to, please make sure that they get training on that. And a big thing, don't forget, your retail food specialist can actually help with training needs. So don't be afraid to reach out to them and ask if there's any kind of resources or any kind of support that we can provide. We're happy to do so. If you are doing an observational visit like we do at FDA, check your statutes. If it's a non-regulatory visit, they may have the ability to refuse participating in the study, and that's okay. A big way that we get folks to participate in our study is we really sell the idea that they're helping us get good data to then improve our programs and help them out. It's a non-regulatory additional interaction, almost like a consultation, and really we're quite successful at getting in the door. Very few refusals, but do keep that in mind. The other thing that we do is we provide a letter to our operators that have been chosen for the study so that they get an overview and understand the benefits of participating. And if this is something that you'd like to do, reach out to your retail food specialist. We do have a copy of that letter that you could then amend or adjust in any way that would work best for you. The last thing that I want to talk about when it comes to a data collection is just being prepared with policies and procedures, because sometimes data collections are slightly different than a routine inspection depending on your approach. So be aware, you should probably have some backup plans if a PIC refuses to participate, an establishment's incorrectly categorized, or they're no longer operating. Again, have the procedure be to pull something off the backup list in the correct order. Talk to your staff about how you want them to handle corrective actions in a voluntary setting. And have marking guides, marking instructions, or if that's not clear and people still have questions, have a go-to person that they can contact to ensure good quality assurance and thorough marking throughout. Okay, so now I'm going to switch gears a little bit, and I'm going to go with the second main option, and that is the inspection data approach. So what this one uses is routine, I'm going to emphasize that again, routine risk-based inspection reports to start assessing risk factors. You don't want to use follow-up inspections, complaint inspections, or environmental assessments. You really want to use routine inspection reports because those are more likely to observe more of the practices and behaviors that are tied to those risk factors that we're trying to measure. Now, a key thing with an inspection approach is you're going to want to figure out how do we measure risk factors. With our data collection approach, we have a very streamlined and a simplified inspection form, which Catherine's going to show you in a little bit, where we focus on data items that are tied to specific risk factors. If you're using violation data, you might want to develop a crosswalk where it pulls the food code or violation references from your system that you're going to use to measure the risk factors. And one resource you might want to look at, like the bottom third, I want to say, of our marking instructions, which are actually available on our FDA webpage, shows you how we have taken the food code references, we've tied them to data items, and then we've locked those to the measurement of risk factors. So you could easily just pull from that sheet and know what violations to use. That way, when you're looking at your violation libraries, you're looking at your reports, you're not overwhelmed with the amount of data that's there, and you're actually able to focus on the violations that measure best what's happening in your community. Now, some other things about inspection data. Key thing, your inspection form has to use in, out, NO, or NA. Or again, you don't meet a foundational piece of standard 9, and as you're going to find out, it will skew your data. All right, we don't want that. We want accurate data. So an example inspection form that would meet this need, you can find it on the CFP website. You can also find it in the annex of the food code, but you want to make sure that you have something that closely mirrors this. It's very important that inspectors have the ability to mark when they were unable to make an observation, either because it wasn't happening at the time of the inspection, or it just simply doesn't apply to that food flow in that establishment. Key thing, very important. Again, you're going to use routine inspection reports. That's very important. And recognize that when you're going in and doing routine inspections, while we're really good about basing it in risk, we want to have those key conversations, those educational elements, we can't dismiss the fact that part of that inspection is all about compliance, right? We want to get people to make changes. And sometimes just because we do have competing priorities, we're also looking at GRPs and a variety of other things, there are some things that may go unobserved. So really making sure that people focus on the observation of risk factors to get the most robust data set that you can when you do inspections is key. Now, a big thing with inspections, quality and consistency. If you're a jurisdiction that's had a lot of turnover, or maybe you're still trying to iron out your uniformity protocols, or maybe your training protocols, using retrospective inspection data might not be the best approach for you. You want to make sure that the data you're using is of high quality. So if you've got inspectors that are trained and on lock, you've got your uniformity down, this could work well for you. But if you're a jurisdiction that hasn't quite gotten there, I would encourage you to think about a different approach or talk to your retail food specialist about some ways that you can kind of mix the two or improve your system, right, to make sure that you get where you need to go. Another thing about inspections, remember when we were talking about data collections, how there were separate visits and we wanted to sample so we didn't have to go to all of them? If you have a routine inspection form for all of the facilities under your purview, you actually have the ability to get that population metric. So you do not have to necessarily sample, providing you have all of the data. Now, when it comes to inspections versus data collections, I told you we talk about the pros and cons. And as you guys can already tell, there are some definite trade-offs. With inspections, of course, there are less field resources that are going to be utilized. You can use all of your establishment data, particularly if you have a full data set, right, and it's high quality. You can expand your scope. If you have a really dynamic inspection system and it's easy to select different violations, you can look at more things beyond the ones that are tied to risk factors. The downside, though, as you probably picked up, it can be a little confusing figuring out that crosswalk. So it's something you really want to iron out before so that you're not overwhelmed with the amount of data in your system. It is a retrospective approach. So whatever you have is what's there, okay? So there's no way to like eliminate inspectors who maybe haven't gone through the training procedure. What you have is what you got. There are some quality assurance challenges that you're going to want to tackle. You're going to want to make sure that people are fully trained. You have checks for uniformity. Otherwise, your inspection data may not be telling you exactly what's happening in your community. Again, also think about the fact that in inspections, you could have some competing priorities. And depending on your database where you're pulling this inspection data from, it could mean additional admin work or maybe some upgrades to your inspection system to make sure that you can pull the data that you need. Now, on the flip side, with the data collection, the pros, it can be standardized. You can include the staff that have gone through pertinent training. You can focus specifically on data items, which will actually make your analysis later on a little bit easier. You can also ensure quality assurance as you go because you're really entering data as you go along. You're not going line by line over something that already exists. Some downsides, of course, there are some additional resources. There may be some specific training you need to do. You will need to use that statistical sampling quite likely, and you may need some additional quality assurance protocols for the different form and the data entry procedures. So a common question that we get is, well, could we do a data collection and have it count as a regulatory inspection? There's nothing in Standard 9 that says that you can't, but keep in mind when you're combining things like that, there could be some conflicting priorities and you're going to have to find a way of making sure that you get high quality data for your data collection as well as meeting all of your regulatory priorities. So with a standalone data collection, you have that focus. You're wearing one hat. You can use a separate simplified form. You can do marking specific to the collection. You may end up with improved quality. If you're combining it with a regulatory visit, of course, you're going to have fewer refusals. There's a better balance with resources. But the downsides is you're trying to balance those two hats. You're trying to maximize your observations while still trying to take care of the regulatory and compliance angle. So some things you want to think about is how you can try and minimize the conflict. whether it's filling out a separate form, trying to tackle the observation piece first, and then stepping in and being that regulator. Just make sure that you have a way of meeting the study needs in a way that works for you and meeting all of the regulatory obligations. And that can be challenging, but there are ways to do that, and you can talk to your retail food specialist. Okay, so I threw a lot at you right off the bat. And what I want to do is have a little woosah moment, distill it down into the key steps when you're thinking about study design. First off, outline your goals. As we've talked about, your goals drive the design. Then take a look at the resources that you have and the resources that you need to meet those goals, and think about what you can feasibly do. At this point, it's a really good time to reach out to your retail food specialist and talk about what are some additional resources we have access to? What do you think? What have other jurisdictions done? Is there a jurisdiction you can put us in contact with? So then at that point, you can find the best balance and pick the design that makes the most sense for you. At that point, if you're doing a data collection, figure out a data collection schedule that's going to work to meet your workforce needs. And then with a data collection, pull your sample size, pull a random sample if needed. And again, you can reach out to your specialist if you have questions or would like some additional resources. Next, regardless of your approach, you got to make sure that people are trained and prepared. They know how you want them to mark things. They have training on the form and the data collection tool. If they have a separate database, they know how to enter that data. Make sure that they're comfortable and well prepared. Again, your specialist can be a good resource for that. And then, of course, quality assurance measures. Have these built in before you even walk through the first door to do an inspection as a part of the study or a data collection as a part of the study. Quality assurance starts right at the beginning and weaves throughout the study process. And we have an entire section today that's dedicated on quality assurance. So with that, I will turn it over to Ms. Catherine Del Mundo to talk over the FDA data collection form.
All right. Thank you. Yes, that was a lot of information. Thank you, Alicia. So Alicia talked about study design and how you can either do an observational data collection or a file review. So the next topic that I want to cover is FDA's data collection tools and forms. And similar to what we saw Alicia cover, FDA has created tools that you can use if you'd like. So one thing I'd like to emphasize is that you do not have to use this approach or tool. You have the flexibility to use your own. It could be your inspection form, this tool, a database, or a separate form that you've developed specifically for your risk factor study. So for our session today, I will be going over FDA's data collection form to show you how we can do it, and you are welcome to adopt it, change it, or even create your own. So with that said, and as Alicia mentioned during her topic on meeting standard 9, the form that you use must collect data on the 5 risk factors using the in, out, NO, and NA approach. So here's a sample of our collection form, and it has many sections, most of which are optional for you, but necessary for us. So FDA's data collection form asks for general information in different categories. So part of this information you will probably already have in your database or you collect as part of your inspections. Other information areas are important for us to collect because we do collect data all over the country. So we'll go through these sections so you know what we collect, and if there's something that's of interest to you, you may consider adding it to your own collection. So something to note, while these sections are not required for Standard 9, you do need to be able to show that you included all pertinent facility categories. And if you choose to use our risk factor study database that Mike Nordos will go over later, some information from these general sections would be required to include in order to handle your data correctly. So first up, we have general information. So our first general information is the industry segment. So this section of the form covers the facility category and the subcategory. So for example, restaurant will be the category and fast food or full service will be the subcategories. And again, you can tweak our FDA forms to reflect this portion for your own forms. Next, collection information. So this covers the date of the data collection, the name of the data collector, time in and out, the total time, and the risk factor category for that establishment, which Alicia briefly covered in her section. For establishment information, this covers the establishment name, their address, the number of employees that they have, the activity level, average meals, and seating capacity. Multi-unit operation asks whether the facility is part of a chain or franchise or is a single unit operation. Now, for information on regulatory authority, this covers information about you. So in this section, FDA collects data on program standards, whether you use a grading system, and information on whether you require food handler cards or your certified food protection manager requirements. So this would actually be interesting in statewide risk factor studies where jurisdictions can adopt their own local rules. But for the most part, you have this data already. And like I mentioned, we in FDA collect this because we collect data all over the country. So last, for most recent routine inspection, we ask for the dates of the most recent routine inspection. And again, this is information you already have, and it's not something that you necessarily need to collect for your study. So again, going back to what we discussed earlier, the only requirement for Standard 9 in terms of your forms is the collection of risk factor data items using the in, out, NO, NA conventions, and you would need to include the industry segment if you don't have another way of showing the facilities that you included, or if you plan to assess industries separately based on your study design. Now, speaking of the requirements for your data collection form, let's do a quick knowledge check. And yes, there are activities in this workshop. So if you can use the chat to answer the question, what are the 5 foodborne illness risk factors? Hint, if you have your food code, it's in the preface. Go ahead and drop the chat or drop the answers in the Pathable chat. Yes, and they're all coming in. That's awesome. I believe you all pretty much got that. So the risk factors that we would need to assess in our study are improper holding, inadequate cooking, contaminated equipment, unsafe sources, and poor personal hygiene. So great job. All right, next knowledge check. Your data collection form must use what to record observations? Again, go ahead and drop it in the Pathable chat. Yay, yes, that was the easy one. So in your forms, you must include the in, out, NO, NA to record your observations. So great job, everyone. All right, so next, FDA's form captures observations under 2 sections. So the first one, primary data items, captures information on 4 of the 5 foodborne illness risk factors, as you can see on this slide. So the 5th risk factor, which is unsafe sources, is actually captured under data item number 17. So this one was removed from the primary data items for FDA because of a history of low out of compliance percentage. So data item 17 falls under additional data items, which I will cover in a bit. So on this slide, you'll see a table of 4 of the 5 risk factors. Okay, and the data items that are associated with those risk factors. So the data items allows us to assess control of risk factors through measurable food safety practices and behaviors. So for example, poor personal hygiene risk factor has 2 primary data items that's associated with it. Employees practicing proper hand washing and not touching ready-to-eat foods with their bare hands. So that means we can assess control of poor personal hygiene by observing compliance with hand washing and no bare hand contact requirements. So this brings us to additional data items. So this section has data items number 11 to 19, which covers additional areas like hand washing facilities, general hygiene, consumer advisory using time as a public health control, special processes, storage and handling of toxic materials, and allergen awareness. So these are all considered additional items, and you can pick and choose which of these items that you would like to add as part of your study. Now, remember I said earlier, FDA moved unsafe sources from the primary data items to this section. So this means the only data item in this section that you must include as part of your study for Standard 9 is data item 17, which covers food received from safe sources, since this is a risk factor. So moving on, let's go over informational statements that are a part of our forms. So under most of the data items that's listed, a list of information statement is provided. So these information statements are preceded by a letter for organizational purposes, and they basically describe specific observations that's associated with the overarching data item they fall under. So this slide provides an example for data item 9. Raw animal foods are cooked to required temperatures. So the information statements for data item 9 are listed in statements A through F, which covers cooking for different types of raw animal foods. So our forms include information statement to help, for one, record observations being made. So data collectors have an option to check a box rather than write a narrative statement, which ultimately this enhances quality assurance pertaining to the interpretation of the data that's being collected. So standard statements provide a means for maintaining uniformity and consistency among multiple data collectors. Another thing to note, and if you did notice, the way the data items and informational statements in FDA's forms are used, they are not written with code language or regulatory tone. So FDA worked with the National Restaurant Association to make the questions more industry friendly. All right, so we went over FDA's data collection form. Let's do another knowledge check. So if you use FDA's data collection form, what data items are required? Again, go ahead and drop it into the Pathable chat. So what data item numbers are we looking at? What do you need? Yes, I see it. I see the numbers coming in. And that is correct. You must include the 10 primary data items and data item number 17 for unsafe sources. So remember, you must measure all 5 risk factors. So great job. All right, so key takeaways from this section. 1, the data collection form, like we mentioned, the one that we just reviewed, is an optional resource that you can use. You can adapt it, use it if you don't want to recreate the wheel, or create your own to meet your needs. However, whichever form that you use, at a minimum, it must measure the 5 risk factors. And if you were to use our form, that's data item 1 to 10 and 17, and your form must identify the industry segment that you are collecting from and record in observations using in, out, NO, and NA. Now, if you were using the risk factor study database, you may need to include additional information, such as general information like establishment name and address. And again, that's to help handle your data correctly. And you may also need to include additional features that you decide to opt into. And we'll cover those additional features later. All right, so now that we went over FDA's data collection form, our next section will cover FDA's marking instruction for the data collection form that we just went over. So this gives you an idea on how you can approach this. Again, like the form we just went over, you are welcome to use this resource for your own data collection, or you can use it as a base for your quality assurance checks. You can even use this information to assess how you want to parse out your inspection data. So you can find both our data collection form and marking instruction on FDA's website. Also, if you go to the workshop page in Pathable, all the resources, tools that Alicia covered, and all the links that we will use throughout this workshop, including this one on the slide, are provided under the resource section on the page. So please feel free to check it out and download them. Okay, so before we dive into marking conventions and goals, let's touch base on data items versus information statement. So understanding the relationship between information statement and data items is important as we work through this section. So remember, information statements assess food safety practices that's related to the data item, and the data items address foodborne illness risk factors or other areas of interest. So with our cooking example on the slide, we can determine whether an operator properly cooks different categories of animal foods, which is captured by the information statement. And then these information statements together show if raw animal foods are cooked to the required temperature in the facility. So as we go through the marking examples, you will see how the marking for the information statements determines the marking for the data item. So something that is important for Standard 9, and we've repeatedly gone over it, that is that you must collect data using the form with the conventions in, out, NO, and NA. You do not want to leave off NO and NA because this will inaccurately capture your observations and artificially inflate compliance. So each information statement and the associated data item must be marked in, out, NO, or NA. So we'll cover the rules in a moment, but let's briefly cover what each of these marks mean, which I know most of you are familiar with. So in means all observations meet the food code, while out means at least one observation did not meet the food code. NO, or not observed, is marked when an applicable practice could not be observed at the time of the data collection. NA, or not applicable, is marked when the practice does not apply to the establishment. So let's go over a couple of examples. So in this example, an establishment that normally cools cooked TCS food is not cooling at the time of the data collection. However, they do not cool TCS foods from ambient temperature. So for this example, information statements A and C are marked NO, since this is a practice that the establishment does, but it is not happening at the time of the data collection. Now, since they don't cool TCS food from ambient temperature, B is marked as NA, okay? All right, so let's start working through marking rules. So the first rule, marking rule 1, you must mark each information statement as in, out, NO, or NA. So this is important because that marking for the information statement determines the marking for the overarching data item that they fall under. So this rule and the rules following it are important for those doing quality assurance checks on the data collection. Next, for rule 2, it says that if any information statements are marked out, then the entire data item is marked out, even if everything else is marked in. Okay? For marking rule number 3, it says that if any observation for an information statement is marked in or out, then the overarching data item that they fall under cannot be marked NO or NA. So in this example, we see that the data collector was only able to observe one category of raw animal foods being cooked, while the rest of the information statements were marked NO or NA. Since the data collector observed one of the food safety procedures, the data item cannot be marked NO or NA, but it must be marked in or out, according to the practice that was observed. So in this example, data item number 9 is marked as in. Next, we have marking rule number 4. So this rule actually has 2 parts. First, if no observations were made in or out, but at least one item was marked NO, then the data item is marked as NO. So that brings us to the second part of rule 4. The data item is marked NA when all the information statements are marked as NA. Next, we have marking rule number 5, and that says that if all information statements are marked the same, then the data item must be marked the same as the information statement. So in this case, you see everything is marked as NA, then the data item is marked as NA. So the same would be true for in, out, or NO. So marking rule 6 covers the information statement that's titled Other. If a data collector marks this information statement as in or out, they should provide a comment in the box below the information statement to capture what they saw. So this will really help those that are doing the QA understand the marking and what questions to ask the data collector in case they need more or additional information. So last, we have rule number 7, which says that if any information statement is marked out, the data collector should provide information as to the out of compliance observation in the comment box. And again, the comment box is there and helpful for those that are performing quality assurance checks. All right, so we did go over marking rules. Let's do a quick knowledge check activity. And again, please type your answer in Pathable chat. So how would you mark this? So we have 1 in, 1 out, and the rest are NA. And bonus if you can identify the marking rule. Okay, I see a lot of the answers coming in. So per marking rule number 2, the data item must be marked out since the information statement B is marked out. Okay, all right. How about this one? How would you mark the data item? So we have 1 NO and the rest are NA. And again, bonus if you can identify the marking rule. All right, I see the answers coming in. So per marking rule 4A, the first part of rule 4, since no observations were made in or out, but information statement is marked, information statement for A is marked as NO, then the data item is marked as NO. All right, great job. Okay, so here are some essential principles that we use with taking food temperatures. First, determine compliance based on food temperatures, not just a discussion with the PIC or the food employees. However, you can use the information that they tell you to support the assessment that you made for the temperature, right? So for us in FDA, we do not stop taking temperatures once we determine a data item is out. We continue taking temperatures and we record all our findings, whether they're in or out. So we do this because we want a represented sample of temperature control in an establishment, since we do a temperature summary that shows the number of observations in and out. And remember, 1 degree off from the critical limit means the temperature is out, and it doesn't matter how many temperatures are in during your assessment. If 1 temperature is out, then the data item is marked as out. So with our data collection form, it has several food temperature charts. So this slide covers some of the column headings that you will see if you use our form. So each table will ask for the name of the food product, and this is simply the common name of the food. And each chart will ask for the temperatures that you observe, such as final cook temp, final reheat temp, or food cooling temps 1 and 2. So the cooling chart will ask for the time between your observed temperatures for each cooling food. Some charts will also require you to add the applicable critical limits. So for example, cold holding has 2 critical limits, 41 for most TCS foods and 45 for raw shelled eggs. Now for cooking, it has many different critical limits, and we'll see how cooking plays out in a couple of slides. So here is an example of a completed table for cold holding temperatures for data item number 5. So as you can see, the table asks for the name of the food, and again, could just be the common name of the food product, the food temperature, the critical limit from the code, and where the food was held cold. For cooking, this is covered under data item number 9. So for this chart, you write the food in the first column, put the final cook temp that you observed in the second column, then followed by the code requirement for the food in the third column. Now, the last 2 columns on this table capture whether the product has a consumer advisory that meets the requirements. So you would select yes if the customer ordered the food undercooked and the facility has a consumer advisory that meets the rule. No would be selected if the customer did not request the food undercooked or if the establishment's consumer advisory didn't meet the rule. In FDA's study, we drill down on the distribution of temperatures that we collect. So our database takes the information from the temperature table and counts the number of foods that are in compliance, which you can see on the top row. Then it counts the number of foods within 1 to 2 degrees, 3 to 4 degrees, 5 to 9 degrees, and more than 10 degrees away from the critical limit in the subsequent rows. Now, if you decide to use FDA's risk factor study database, you can run similar reports and see the temperature distribution above the critical limit for your study. Now, you do not have to do this part for standard 9. However, if you'd like to include this, it might give you an idea about how far out of compliance temperatures are. For example, in this slide, cold holding. So for example, if most of the temperatures are in or 1 to 2 degrees out, that paints a very different picture than if most of the temperatures are 5 or more degrees out of compliance. So this could then help you decide if cold holding is a priority issue, and it can also potentially help inform and plan strategies you use for intervention. So there's value in that. So some key take homes for this section. So as with other resources that we've covered, FDA's marketing instructions are an optional resource. So you can use it if you'd like to, adapt it to fit your needs. But whatever you decide for your study, one thing I do encourage is to have a support document for your data collectors and your quality assurance folks to use. Another thing to note, the marketing instructions should not replace training. Providing data collectors and quality assurance staff training on procedures is still very, very important. Okay. Oh, sorry. So I believe we have a break built in. Hold on. And now for something completely different. So based on our agenda, we do have a 15-minute break planned out for everyone. But before we go on break, I'd like to touch on an announcement that was made during yesterday's general session. So yesterday morning at the FDA headquarters in Silver Spring, Maryland, the FDA and CDC officially entered a Memorandum of Understanding to formalize our partnership to reduce foodborne illness risk factors at the retail level. So the MOU is the first of its kind, and we are so excited about the projects that will support all of our food safety outreach and regulatory work. So outcomes will support the types of research we've heard about this week, such as the value of food safety management systems and risk-based inspections. So the MOU has 3 primary goals. 1, increase uniformity, consistency, and capacity of our state, local, tribal, and territorial retail food protection programs. 2, promote industry's active managerial control of foodborne illness risk factors and promote a culture of food safety. And finally, 3, maintain a strong FDA National Retail Food Team and CDC National Center for Environmental Health workforce to provide assistance to our SLTT partners. So we do have a video that we will be playing during the break for you to review at your leisure. As a reminder, please do not exit this session. You can just leave it running during the break. And so I believe, Kenya, I am handing it over to you to play the video.
Hello and good morning, everyone. I'm Abe Brown. I'm the Senior Advisor for External Engagement in the Office of Partnerships in the Office of Regulatory Affairs for the U.S. Food and Drug Administration. Today, we are celebrating the signing of a Memorandum of Understanding between FDA's Office of Regulatory Affairs, FDA's Center for Food Safety and Applied Nutrition, and the Center for Disease Control's National Center for Environmental Health. This agreement marks a significant step and a significant leap in this relationship. This will be signed today, September 21st, 2022, and this MOU formalizes each partner's commitment to reducing foodborne illness at the retail level. The long-standing relationship we've had between FDA and CDC includes years of effort and years of collaboration, and this document today will signify and formalize that collaboration with the ultimate goal of reducing foodborne illness and moving to the next phase as we document our progress and our continued growth. At the end, we will achieve what we've been wanting to achieve for quite some time, which is a vision of a national integrated food safety system. We have 3 signatories here. Our partners are represented by Dr. Judy McMeekin, who is the Associate Commissioner of Regulatory Affairs at the FDA. We have Dr. Susan Main, who is the Director of FDA's Center for Food Safety and Applied Nutrition. And we have Dr. Patrick Bricey, who is the Director of CDC's National Center for Environmental Health. Judy, take it away.
Good morning. I am really pleased to join Dr. Main and Dr. Bricey in signing this Memorandum of Understanding between the Centers for Disease Control and Prevention and the Food and Drug Administration, focusing specifically on reducing foodborne illness at the retail level. FDA's new era of smarter food safety blueprint calls for modernizing the U.S. retail food protection system, including identifying new partnerships and strategies to help ensure the safety of food sold at retail and food service establishments. FDA plays an integral role in increasing uniformity, consistency, and capacity of our state, local, tribal, and territorial retail food regulatory programs. We also promote industry's active managerial control of foodborne illness risk factors and a culture of food safety, as well as providing training to maintain a competent, skilled regulatory workforce. FDA's efforts on the new era of smarter food safety blueprint, combined with CDC's expertise in conducting foodborne illness investigations and leveraging research to understand the causative factors of foodborne illness, provides increased support to partners and industry. I'm confident we'll meet our goal of reducing foodborne illness at the retail level by leveraging our capabilities and maintaining a forward-thinking perspective. I want to thank CDC for their continued partnership, and we look forward to continuing to collaborate with CDC as we advance our shared mission to protect public health. Susan.
Good morning. I'm thrilled to be here today with Dr. McMeekin and Dr. Bricey, taking another step together to help strengthen the safety of food sold at retail. The FDA and CDC have been working together to enhance our retail food protection system for many years, and this MOU reinforces the long-standing partnership between our agencies and facilitates continued efforts in this area. The signing of today's MOU will help us move forward several fronts. First, our joint work in this space will help increase the consistency and capacity of retail food protection programs across the country. Second, it will further promote a general culture of food safety. And third, it will facilitate continued communication between the FDA and CDC, helping us better assist our state, local, tribal, territorial, and industry partners. This MOU is another step in our continued work to support food safety at the retail level. For the past 30 years, the FDA has helped support state, local, territorial, and tribal partners through the Food Code. The Food Code, which will celebrate its 30th anniversary next year, is a model for safeguarding public health and ensuring food is unadulterated for consumers. It provides uniform standards to better ensure compliance. It establishes a standardized approach for inspections, and it helps protect consumers and industry from potentially devastating health consequences and financial losses. Our collaboration with CDC has helped inform our work on the Food Code. Our CDC counterparts have been instrumental in identifying foodborne illness risk factors responsible for foodborne illness outbreaks. These efforts help us measure the occurrence of practices and behaviors that contribute to foodborne illness outbreaks at retail food establishments. Through our ongoing partnership with CDC and with the signing of today's MOU, we will continue to leverage the collective strengths of both of our agencies to drive down foodborne illness in retail and food service establishments across the country. I'm excited to be here today to officially recognize this partnership. Over to Dr. Bricey.
Thank you. CDC's National Center for Environmental Health is pleased to participate in the signing ceremony with the Food and Drug Administration. Despite improvements over time, foodborne illness risk factors remain responsible for many foodborne illnesses. Each year, more than 48 million Americans get sick and over 3,000 die from foodborne-related illnesses. Protecting food safety in the retail setting is an important component of any food safety system. About a third of all meals are eaten outside the home, and more than 2/3 of foodborne illness outbreaks that occur each year are associated with food produced in retail settings or other food service establishments. The United States spends approximately $78 billion per year on health care, workplace, and other related costs associated with foodborne illnesses. We know we can only achieve our vision to reduce or eliminate foodborne illness risk factors by working together through strong partnerships and collaborations with our federal, state, local, and territorial partners, including many organizations that work with and for them. This Memorandum of Understanding represents our joint vision and ongoing partnership to protect from threats to public health, including foodborne illness. We are pleased to contribute and support FDA's ongoing efforts to promote science-based food safety principles in retail and food service settings to minimize the incidence of foodborne illnesses, and we applaud FDA's leadership in this space. FDA's leadership and guidance have resulted in nearly 90% of the U.S. population living in a jurisdiction that has adopted some version of the FDA Food Code and its science-based food safety principles. We know these food safety principles are effective for protecting public health, and we'll continue to work collaboratively with FDA to encourage the adoption of the latest version of the FDA Food Code. CDC will continue to support state and local environmental health programs in the identification and prevention of foodborne contributing factors. We will continue to work with our EHSnet partners to conduct valuable research to better understand the contributing factors and environmental antecedents to foodborne illnesses and outbreaks at the retail level. We'll also continue to collect and translate high-quality surveillance data on contributing factors and environmental antecedents to foodborne outbreaks through the National Environmental Assessment Reporting System, known as NEARS. Together, these programs have allowed CDC to recommend food safety prevention practices, policies, and training using systems-based approach, as well as strengthened collaboration among epidemiology, laboratory, and environmental health programs among local, state, and federal partners. The work CDC and FDA do is synergistic, and we are excited to expand our collaborative work with FDA to improve guidance, education, and implementation of food safety best practices through this MOU. By leveraging our strengths, CDC and ATSDR, in partnership with all of you, our epidemiology, laboratory, and environmental health program partners, we will be more successful in reducing the occurrence of foodborne illnesses and risk factors in the retail food service environments. Thank you.
Thank you very much. And now for the signing. Judy, if you may begin. Now, Dr. Bryson. Now, Dr. May. Thank you. And Judy, if you can show our viewers. Thank you. And congratulations.
Thank you.
All right, I believe now we're due for our 15-minute break, so I will set a timer for us to return in about 15 minutes. Thank you all. All right, welcome back, everyone. I hope you found that break to be refreshing and get ourselves re-energized to be back to talk about risk factor studies. I'm taking it away on the next section here. All right. Okay, so now we're going to take some time to talk about how to tackle the data collection itself. We will talk about some general strategies that you can use to work with your operators, how to conduct a walkthrough, and where to focus your attention. We will take time to discuss how to handle the type of those on-site fixes and those corrective actions, and to tackle some situations that could affect your data collection. You will see that there are many similarities between a data collection and a risk-based inspection, but we will take some time to highlight some key differences here today. Okay, so where to start? It is encouraged that you do a visit it's not pre-planned. It's going to be one that you just kind of just surprise them unannounced for your data collection. And if you're doing an observational data collection like we do at FDA, your first type of impression could mean the difference in getting the data that you wanted and to be turned away at the door. We will be talking about some of the different techniques on how to handle that going forward. But let's say that we were able to talk our way in. So what are some of the type of equipment and supplies that you need to plan on having available for your data collection? And for that equipment, is there any calibration that's needed? I would love to hear from you all. Let's see what you have to say in the path of the chat here. Drop in some ideas. What are some equipment that you want to take along with you on your data collection? Thermometers, of course, right. Is there anything else that we should take? Flashlight, a torch. Hey, maybe I need to burn that place down, right? Some alcohol swabs, test strips, great. Your mighty pen, which I've heard that the pen is as mighty as the sword in our profession. So those are all great suggestions there. And then for that equipment, is there any calibration needed? Business cards, patients, yep, calibration of thermometers, perfect. That's exactly what I was looking for. So great feedback. So as we just discussed, you want to make sure that you are equipped to collect the type of information that's relevant to your study. That means having the right equipment. And when it's needed to have it properly calibrated, this will ensure that your temperature observations are accurate. It is strongly suggested that you verify the calibration of your thermocouples and your temperature measuring devices during the data collection using the ice water method. This slide here shows you some basic equipment that you should always have with you. So we mentioned hair restraints, our swabs, thermocouples, temperature measuring devices, backups, flashlights, test strips, things like that. Some additional things that you may want to consider is bringing along some blank data collection forms, the marking instructions that Catherine just shared with us, your study protocol, and just general reference type of books and reference documents that can help your data collector while they're on site. Those are all great tools to take along with you. So like with any inspection, you want to establish rapport and credibility right away. You want to greet the person in charge and discuss the purpose of your visit. For those who decide to conduct a voluntary data collection, be prepared to sell the idea. Basically, I almost have to convince them about the merit of your study. For those of us that want to conduct this data collection as part of a regulatory visit, you want to conduct your regular type of way to get yourself in, your regular type of introduction. And you want to make sure that you're going to make it clear that this inspection, this visit will take additional time because you'll be asking additional questions. So you want to be very transparent early on about how this visit will be different than their routine inspection. So what happens if the person in charge does not want to participate in the voluntary data collection? What do you do? This is where it's important to know what the procedure is or what your policy is on how to replace an establishment that does not want to be part of the study. You should have protocols on how to handle some establishments that are in the wrong category. So say that you set out to study a retail food store with a deli and you show up and find out they don't have a deli. Or you want to have some policies and some procedures on how to replace those businesses that are no longer operating. So say that you show up and they have closed up shop. Have your guidelines and procedures outlined for those situations. So once we get all of our introductions out of the way, the first step to any inspection, including a data collection, is to get a lay of the land. This is where your walkthrough comes into play. The walkthrough should be quick, and when I say quick, I mean a 2 to 3 minute survey of the establishment's kitchen and food preparation areas. The purpose here is to outline and identify food preparation activities that are happening, so you can really establish your observational priorities and outline the flow of your visit. Typically, during this walkthrough, you don't want to stop and tackle any issues that you see during that walkthrough, but take this time to map out what should be your priority. If possible, you want to look at the menu before going on site. This will help you get an idea of the type of foods that they serve, what type of processes that you might see, and to kind of have a list of pre-formed questions that you want to get some clarification on. When you arrive on site, it's best practice to request the menu so you can have with you during your data collection. But you're not going to do a menu review on site per se, but just simply use that as a reference document, because you'll go back and look, oh yeah, I forgot they have meatloaf. Let me go and ask about that. So it just kind of serves as a reference for you while you're on site. Like most of us know, just before starting your walkthrough, you want to ensure that your hair is properly restrained and that you've washed your hands. While you're finishing up that, this is a great time to ask those targeted, pointed questions to get an idea of what's going on in the kitchen. And you can kind of look around, have your head on a, just look around in a sense, so you can prime your walkthrough and make some observations to get a greater sense of what's going on. Head on a pivot, that's what I was trying to say. Once you finish your hand wash, this is where you're going to start your actual physical walkthrough. Going to go in one direction, and you're going to focus on where the most food preparation is happening. While you're conducting this walkthrough, you're going to pick out those food preparation activities. You're going to do a quick check-in on cold holding units, on the ovens, on hot holding equipment, so you can get an idea of what's being held, being cooled, or heated. This is a great time to ask questions about what you're seeing to get a better understanding. For example, you may peek in one of their holding cabinets or in one of the stoves or in the oven and see that there's a roast cooking. And this is where you will want to ask to be clear if they're cooking it, are they reheating that roast, or are they simply holding it? For those that are cooking, this is a great time to figure out when the heating process started so you can figure out when it's going to be done. This is where you can figure out where it fits in your priority list. So if they just started it, then you know, hey, let's come back to check it later on, maybe in an hour. Or if they've been cooking it, this is about to come out. This should be one of my first stops for sure. Once you've completed your walkthrough, this is when you can determine where to start your data collection based on the relative risk of the different foods and the activities. This is where you can really outline and map out which activities are static, meaning that they're not going to change rapidly, or those that are dynamic, that if you don't catch it then or really early on, then you'll miss that chance for the observation. And of course, you always want to focus on the needs of your data collection. For an example, you may have seen somebody doing bare hand contact with salad prep items. And on the other end, you might have noticed a bunch of food that wasn't being date marked. In this example, your priority should be tackling the bare hand contact due to the potential for norovirus and a host of other fecal oral pathogens. And the fact that their food will be out for service soon and their bare hand contact is a primary data item on our data collection form. So here we can quickly see that we have a high risk practice, it's a dynamic action, and it fits the needs of our data collection. So that should be one of our key starting points. On the other end, day marking is important, but the risk of listeria is not imminent, and you can always address it later on. We're not ignoring it, it's just not high on our priority list. That's an example of a static operation. We can come back to that. Okay, so some more engagement. I love hearing from you all. So what are some strategic or targeted questions that you should ask during a walkthrough? What are the type of questions that you want to ask? And feel free to drop that into the path of the chat for me, okay? Let's see, I see a few people have any cooling going on. Great, are you cooling food processes? A lot of cooling questions, yeah. What is your foodborne illness policy? Okay, reheat. So I think you all are kind of get what I'm putting down there in a sense, is that we want to try to focus on questions to determine what food is being prepared, what activities are currently underway. Focus on things like cooling, as we just saw here in chat. Ask about what's currently cooking. I saw somebody mention about their employee health policy. That may be something that you can start that conversation early on if you see somebody that looked ill. But basically, you want to keep your questions open-ended here and just kind of get a lay of what's going on. So now for an activity that we're going to work through together. So this is an example of a kitchen that we have, and we're going to try to figure out how to best tackle this during our walkthrough. So we'll walk through this together. So first step, of course, we're going to make a beeline straight to that hand washing sink, make sure that our hair is properly restrained, and begin washing our hands. This is when we're looking around, seeing what's going on, trying to decide where we're going to go to next. So let me hear from you all. Where would you go to from the hand sink when you're doing your walkthrough? Where are we heading to next? Prep area, the food line, okay. We're not going to go straight to that dry storage, right? Coolers, the grill, okay. That's the next step for me. That's what I think is the best place to go. So I would take some time to go through this cook line and the prep area. Maybe a little hard for you to see, but on the far left there's a prep table with some produce. Then there's a prep table with some raw meat. So you may be able to see how they handle and make sure that there's no issues of any cross-contamination. We can see if they're cooking anything or holding anything in an oven, like you mentioned earlier about the roast, and just kind of see what's being cooked. So where are we going from here? We've walked through the cook line, kind of get a general observation of what's going on, knowing that it's probably high on our priority list. Where are we going next? Refrigeration line, walk-in, okay. I'm gauging that you all have done this before. That's where I would go next as well. So I would go to that walk-in. Yeah, we'll walk past the washing area. We'll get a general sense that they're washing dishes. And again, that's important. We're not ignoring that, but we just can see that's not high priority now. We'll come back later on. Let's check out the walk-in. Maybe they have something cooling because they mentioned earlier, oh yeah, we have some soup that we're starting to cool, or we just pulled some ribs out of the oven. So you can kind of see what's going on there now, maybe get your first starting temperature for you to come back later on. All right, where are we going from the walk-in? Where are we going after we leave the walk-in? Check the mop sink I saw from Abraham, the cook's line. Ware wash, okay. Dry storage. So best practice is don't double back on yourself doing your first walkthrough. Let's kind of see what else is going on. So next from here, my next step would be that cold holding line, okay? This is where we can see Maybe this is something that's going out for like immediate service. This may be their salad prep area. So there may be some opportunities to observe any bare hand contact with ready to eat foods. And then that way we will have completed our loop and rounded up where we started. So that way we can kind of figure out, okay, now we've been to this entire kitchen, we see what's going on, what is our dynamic things, what are the static stuff, we know where we should go to next. Once you complete your walkthrough, it should give you a better understanding of where to start the focus of your data collection. You will have a greater sense of what activities are currently happening and what your priorities are. And that goes back to our risk factors. That should always be our top priorities during our data collection. And of course, with any risk-based inspection, risk factors are your primary focus. Here, you want to focus your data collection on the data items that Catherine had discussed with us earlier that measure the 5 foodborne illness risk factors. We want to keep in mind that a data collection is not intended to be a comprehensive assessment of compliance with the food code, okay? Our primary aim here is the observation of practices that's covered through data items 1 through 10 and data item 17, okay? These are our 5 risk factors that we're going to be focusing on first. Some of us may choose that we want to add other areas of interest, and these can include data items 11 through 16 and 18 and 19. So if you've chosen to include these with your study, you want to make sure that you're focusing on this as well. This is where you learn not to spend time on our GRPs per se, and really focus on the needs of your data collection. So this is to say, we will kind of learn to turn a blind eye to our 4 walls and ceilings during these data collections. We're only going to primarily focus on our data items that are part of our original study design. This will help make sure that you've included all of the data items that you had set out for in your study design. It helps with a uniform data collection by all of your data collectors, and it helps decrease their time in the field, the resources that's used, and improve their efficiency overall. Okay, more discussion. Which practices or behaviors do we consider dynamic? So what do we think, some of the stuff that we see in the kitchen, what do we consider a dynamic process? Cooking, yes. Cooling seems to be prep, cooking. These are things that can change in an instant, and we may not get another opportunity to witness them again. So these are all the things that we should probably start off with as a high priority. So cooking, cooling, reheat, hand washing, perfect. Those are our dynamic process. How about static? What are some examples of some static things that they're important, but we know that they'll be there for us to assess later on during our visit? The dish machine, storage, date marking, even code holding, absolutely. That's not going anywhere, and it shouldn't drastically change during our visit. Those are examples of great static observations that we're going to come back to assess later on. So let's try a real world example here. So let's say that we walked into the walk-in. Should we take temperatures of like every single food item in there, or are we taking targeted temperatures? What temperatures would you take in this picture here? And to kind of give you more of a reference to what you're looking at, the bottom of this picture is the front of the walk-in. This is where we've stepped in, and the top picture, or the top of the picture, is the back of the walk-in. So just imagine that you're looking into the cooler. So what temperatures are we taking? Large metal pan, various areas, furthest from the fan, closest to the door, covered foods, okay. Meat, prep salads, nice, okay. And the potentially hazardous foods, or our TCS foods, are our focus for sure. I saw that come in. Great, so to go to the first question that I asked, no, you don't need to take temperatures of every single food item in this walk-in. You want to take temperatures of enough TCS foods to get a representative sample. So this is temperatures by the front door, by the back, various heights near the cooling fan towards the bottom. Check if they have any food that's cooling, which I saw somebody mention that if it's covered, look for things like that. So it's a representative sample of what they have going on. Okay. corrective actions. So depending on your study design, your approach to the corrective actions may differ between an observational study and a regulatory inspection done in conjunction of observational, as Alicia had discussed earlier. There's pros and cons to both, but how you design your study will determine how you address your corrective actions. If your study design is observational, you should try to get any corrections whenever possible, particularly when those observations pose a significant public health risk. We realize this may be challenging doing an observational data collection because they're doing this voluntarily. So this is where you try to do your best sales pitch to get the person in charge to voluntarily correct the issue. Sometimes this may be difficult. So if you can't get the correction and you've determined that the observations pose a major public health risk, you want to follow your procedures for regulatory follow-up. This is a classic example of preparing your data collectors with the tools to handle these situations beforehand, so they know what are the procedures, what are the policies, what are the protocols, and give them clear direction for when to implement that regulatory follow-up. In our experiences at FDA doing our data collections, of course, ours are observational. In most instances, the facility management will act in a responsible manner to address those public health risks, but we just want to caution you all to be really prepared just in case that they don't want to, and you have some protocol for follow-up. Okay, so before leaving the establishment, you want to give an outline of the general findings. This is typically done with the person in charge. This will allow you to discuss any significant findings from your data collection and even help them to come up with some corrective actions for if you haven't had a chance to address that already. This adds a lot of merit to the training that you can provide and will help build that sense of rapport and that you're trying to collaborate with them. During this exit briefing, the person in charge may have some really targeted questions that they would like to discuss. So take this opportunity to give clear answers and to provide further clarity. This is a great time to give them any type of training materials or reference documents or links to training or further information that you think that they could benefit from. For the FDA's data collection, since we are not a regulator or regulatory authority at retail, we don't leave a report since this data collection is part of a research project. So this may be something that you can discuss with your team for a similar type of approach if you're doing an observational study where you're not going to leave a report so they don't feel like anything's punitive, that you're just giving them observations for a best practices going forward. But for those jurisdictions that decide to combine their data collection with a regulatory visit, you want to leave a report that's in line with your statutes and your rules. All right, so key takeaways from this section. I can't underscore this enough to say that training your staff on how to do a proper data collection is important. This is when you're going to go over the importance of conducting a walkthrough, how to establish some priorities during their data collection, and where the focus of the data collection should actually be. We're going to put a lot of control over establishing the rapport and using good communication skills to help make this process as painless as possible. And lastly, you want to ensure that the staff know about the procedures or protocols that were established beforehand to handle any type of issues that may come up, such as a refusal, you're at the wrong type of facility, the business is closed, or you run into some of those major public health risks that were not voluntarily corrected on site. So with that, I will pass to Catherine. She's going to share some information on optional assessments.
All right. Thank you so much, Justin. So, like you heard during this workshop, we here at FDA collect a lot of information in our study. So as a reminder, at a minimum, you need to assess the occurrence of risk factors in the industry segments that you regulate and Justin did a great job providing a walkthrough on how to conduct the data collection. If, however, you want to use some of the optional metrics to assess additional relationships or to inform interventions that you're creating, you're welcome to do so and incorporate them into your data collections. So that's what this section is that we will be covering, optional assessments. So the first optional assessment that I want to go over is on employee health policies, which is a great resource and actually ties into the topics that we've discussed yesterday during our general session. So here we are going to cover the questions we asked to assess employee health, which are also captured in our database if you choose to use it. However, you can definitely develop your own questions to assess employee health based on your own rules or regulations or statutes. So as we go through this section, please, again, don't feel free like you have to approach this the same way we do. If this is of interest to you, you can adapt it. So again, you can listen in on how we conduct these optional assessments and then adopt or adapt them to fit the data that you want to collect. Now, for FDA, we have 7 questions that we use to assess employee health. So these range from marking whether we observe symptomatic employees to the duties and responsibilities of the PIC and how they inform their staff about their reporting responsibilities. So we also ask questions about exclusion and restriction and reinstatement of the employee. So while for our metrics, we ask if they have a copy of FDA's employee health handbook, and that's something that Christine went over yesterday with the videos, this is not something that you need to do. We ask this in FDA. Oh, sorry. So let's do a discussion question. So for employee health, what could you learn if you were to assess this part of the study? And how do you think you can use this data? So if you choose to use this optional assessment, what do you think you can learn from this? And again, type it into the Pathable chat. Okay, policies in place. What else? Okay, if the policy is being implemented, educate, yes, whether employees are likely to work while ill. I see a lot, definitely. All right, so one of the things that comes to my mind is maybe there's a gap in knowledge of what they should have in their policy, right? So we've seen some great presentations during the general session on how that's evaluated in an inspection and possibly collecting this data that can help inform the type of interventions that you'd like to implement. And maybe one of those interventions can include those videos that we saw yesterday, right? Okay, so the next optional area is the hand washing frequency assessment. So hand washing frequency assessment, if you choose to add this to your study, will be associated with data item number 1, proper hand washing. So data collectors would tally each time an employee is observed washing hands properly and when required, washing improperly, or failing to wash hands when required. So on this slide, those are the grayed out column headers with the tally marks under each one. So note on this, marks for improper hand washing or failing to wash when required means the data item is out. So if you choose to add this, the tallies must match the markings for the information statements and the data item. So now, doing the hand washing frequency assessment doesn't mean that you need to plan for additional time to observe hand washing practices. So this data can be collected through the normal course of observing other food safety procedures during the visit. So data collectors should recognize their limitations with this aspect of the study. So the assessment of hand washing frequency in the context of this study is to provide a broad-based indicator of the hand washing practices that's occurring in the facility and should not be used to draw statistical conclusions. Also, the data collector should not forego an opportunity to observe and assess other food safety practices or procedures in order to follow an employee for this frequency assessment. So the data collector should do their best to assess hand washing when the opportunity arises during the normal course of the data collection. If a data collector notices that employees repeatedly miss required hand washes, they should talk to the person in charge and try to get voluntary corrective action, as Justin had covered in his presentation. So if this is done, they should also note this in the comment section under data item number 1. All right, so another discussion. So for hand washing frequency, what do you think you can learn for this, and how can you use that data? And again, drop it in Pathable chat. Habits, definitely. What else? If employees are washing their hands as needed, training. Exactly. See a lot of training with regards to hand washing, supplies. Okay. Yeah, definitely. Maybe when I think about this, some of the questions that asked is maybe the when to wash hands is something folks need more training on rather than how to wash hands. I remember I was out in the field a couple of weeks ago, and it's employees knew how to wash their hands, but they were a little bit lost as to the when they should wash their hands, right? So again, these optional assessments can help inform the interventions that you'd like to implement. Next, the third optional assessment we'll discuss is manager certification. So we use this assessment to examine relationships between trained personnel, particularly the person in charge or PIC, and how well a trained PIC supports food safety management systems and the control of risk factors. So at FDA, we base our manager certification assessment on what's written in the 2017 FDA Food Code. However, you can develop your own manager certification assessment if you have different requirements. So for example, if you do not require ANSI accredited exams, or if you have a state-based program, you can use these requirements as your benchmark. So let's look at how we do it, keeping in mind not only is this optional, but you could adapt this assessment to meet your needs. So when we do data collections, we assess if they have a CFPM or Certified Food Protection Manager employed and whether they are present. If so, we try to figure out if they are the person in charge or PIC. So we also ask if it is their policy to have a CFPM present at all times. Now, particularly with retail food stores, we collect CFPM information, but we also consider whether the CFPM is a store level or a department level PIC. Now, if the PIC is a CFPM, we ask if they have a certificate and we record if they pass the exam through an ANSI accredited organization. So this slide shows the answer options on the form and their associated descriptions. So for example, if the PIC at the time of the data collection is the CFPM and they have their certificate with them, the data collector would choose the first option, yes, certificate available. So you can see these options in the top box. The data collector would then determine if the CFPM program was ANSI accredited, as shown in the second box. If there's a CFPM on site, the data collector would inquire if it is the operations policy to always have one present, as shown at the bottom box. So again, this is how we do it here in FDA. Now, if you do choose to assess ANSI accreditation, there are a couple of ways to figure out if their CFPM program is listed. So you can check the Conference for Food Protection website for a list of accredited courses. The link is also provided in our workshop page in Pathable. So another way you can do it is you can also look at their certificate. So oftentimes they will show an ANSI symbol. So this slide shows a list of the accredited programs, and currently there are 6. All right, last discussion for this section. What can you learn from CFPM assessment, and how could you potentially use this data? And again, please use the Pathable chat. So what can we learn for this? And how can you use this data? Some knowledge about the food code, knowledge about food safety, active managerial control. Definitely. one of the things that come to mind is maybe we can identify if having a CFPM has an influence in the facility's overall control of foodborne illness risk factors, right? So that's one of the questions that pop in my mind. So this actually leads us to our last optional assessment. So Food Safety Management Systems, or FSMS, is the last optional assessment and one that has proven insightful in FDA's latest data collections. So we've heard about FSMS during the general session, so let's take a look at how it's being collected during our data collection. So again, FSMS, or Food Safety Management System, refers to a specific set of actions and or procedures to help achieve active managerial control. So while FSMS vary across the retail and food service industry, the purposeful implementation of procedures, training, and monitoring are consistent components of an FSMS. So at FDA, we want to measure how well developed an establishment's FSMS is so that we can statistically analyze whether there are relationships between a strong system and control over risk factors, and whether things like CFPMs have an effect. So each data collection we do has a randomly assigned risk factor for us to evaluate. So in FDA, we measure food safety management systems using PTM, or procedures, training, and monitoring. So let's go over each component. So first up, P for procedures are a defined set of actions for accomplishing a task in a way that minimizes food safety risks. Next, we have training, or T, and that covers how management informs employees of their food safety procedures and how they teach employees to apply them. And then lastly, we have M for monitoring, which is routine observations and measurements done to check if food safety procedures are being followed and maintained. So each of these components are assessed independently on a scale of 1 to 4, 4 being the highest rating, and then we combine these assessments to an establishment's overall PTM rating. So our FSMS assessment looks at the 10 primary data items and the associated 4 risk factors. And again, unsafe sources is still part of the data collection, but due to the low out of compliance percentages, it's not part of the primary data item. So we look at poor personal hygiene using data items 1 and 2 for hand washing and no bare hand contact. Protection from contamination is assessed with items 3 and 4 for protection from cross-contamination and proper cleaning and sanitizing. Improper holding is assessed with items 5 through 8, including cold and hot holding, cooling and date marking and disposition. And lastly, improper cooking and reheating is covered with data items 9 and 10. So we assess FSMS using a scoring system that evaluates the three components of their system and then averages those scores for a single overall rating. So this FMS score is a continuous variable ranging from 1 to 4. 1 means that the system is non-existent. Scores higher than 1 but less than 3 means it's underdeveloped. Scores of 3 but less than 4 are well developed, and then scores of 4 mean it's well developed and documented. For each area, procedures, training, and monitoring, data collectors looks at 4 things. So let's take a look at procedures. So on the screen, you see the elements that collectors use to assess an operations procedures to prevent contamination. To evaluate procedures, the data collector must evaluate if management knows the critical limits needed to protect food from contamination. If management does, then the data collector would mark the top item as yes. Next, the data collector assesses if the manager can identify the steps or tasks that employees need to make sure that the critical limits are achieved. Again, if the manager can do that, then the data collector would mark this as yes. Next, the data collector looks at whether the manager knows who is responsible for the required task. Again, they would assess yes or no. If the data collector said yes to the first 3 items, they would then assess the 4th element, which evaluates if there are written components to the procedures like SSOPs, posters, charts, cards, and whatnot, and mark the last item as yes or no based on the observation. So the data collector would not assess this 4th element if any of the first 3 items are marked no. So the data collector uses similar questions for looking at training and monitoring. So each area of PTM gets a score of 1 through 4. If 1 or no items are marked yes, then the score is 1. If 2 items are marked yes, the score is 2. 3 items results in a score of 3. And of course, if all 4 items are marked yes, then the score is 4. So the example on this slide shows the procedures assessment for an establishment where the manager knows the critical limits and can describe the required task correctly, but they do not have assigned roles. Since they didn't mark yes for the first 3 items, the 4th element for written materials isn't assessed. So in this case, since there are 2 items marked yes, then their procedures score gets a score of 2. So after assessing PTM for all data items associated with the risk factor, the individual scores are average. So for poor personal hygiene, we need to take a look at the individual PTM scores for both data items 1 and 2. So for the example that's on the slide, you can see that the establishment scored a 2 for procedures for both data item 1 and 2, 3 for training and monitoring for data item 1, and 2 and 3 for training and monitoring for data item number 2. Now, to get the overall score for the risk factor, we take the values for each element, add them all up, and divide them by the total number of elements that's being evaluated. So as you can see, when we add up the 6 scores, we get a total of 15. And then 15 divided by 6 gives us a 2.5, which is the overall FSMS score. So on the last table, you can see that a value of 2.5 means this establishment's FSMS score for personal hygiene would be given a description of underdeveloped. Now, for this optional assessment, rather than asking how you could use this data, let's take a look at the data FDA collected for our deli collection. So I wanted to take a moment and show you the potential value that the FSMS optional assessment can bring to your study using the second deli data collection from FDA's current 10-year study period. So this slide provides a brief overview of the FSMS results for the deli data collection. So of the 397 delis sampled, 12.2% had non-existent FSMS, 56.1% had underdeveloped, 25.8% had well-developed, and 5.9% had well-developed and documented FSMS. So combined, about 32% had well-developed and documented FSMS. So remember, the only difference between well-developed and documented is that there are written procedures which, could improve sustainability over time. So when we further analyzed the data, we found that food safety management systems were the strongest predictor of data items, so food safety practices or behaviors that's being out of compliance. So what this data showed is that those delis with well-developed systems and had significantly fewer food safety behaviors or practices that were out of compliance than did those with less developed systems. So the bar graph in this slide indicates that delis with non-existent FSMS average 4.6 data items that were out of compliance, while delis with well-developed and documented FSMS average 2.4. So on the average, that is more than 2.5 fewer data items that were out of compliance. Another thing we found was that those establishments where the person in charge was the CFPM at the time of the data collection were more likely to have more well-developed food safety management systems, and in turn, less likely to have items out of compliance. So as you can see from this slide, and as Dr. Laura Brown from CDC mentioned during the first day of the general session, food safety management system components are consistently linked with food safety. All right, so some key takeaways from this section. First one, these optional assessments are just that. They are optional. So you can incorporate them based on the goals that you have for your study. So if some of these optional assessments piqued your interest, you're more than welcome to use FDA's approach as a starting point and then adopt or adapt them based on your needs. And as we saw in the previous slides, these optional assessments may be used to examine relationships and may also help you inform the types of interventions you'd like to implement. Okay. All right, so let's move on to the next section. So this next section I'll be covering is quality assurance. So you want your conclusions to mean something. That means you need high quality data that's uniformly handled. And that's what this section is all about. So quality assurance happens right from the very beginning. And it's a great idea to have a designated person or a team for QA, keeping in mind that your approach or your needs could look a bit different than other jurisdictions depending on your study design and resources. It doesn't have to be hard, but you do need to think about it, and it's best to do so in the planning stages. So we'll start by talking about QA and how you sample and curate your list. So the integrity of your study rests on inputs, not just the markings and the data collection results, which of course are also very important. So this includes the establishments that you choose from and how you select your sample. First, if you are going to do a data collection, you must have a random sample. If you don't, your data is not going to be representative and you cannot do a statistical analysis. So this holds true if you're doing a hybrid approach, and a similar concept applies to your inspection data. You have to figure out what you're including, either all routines for the past year to get your population metric, or are you still going to sample? So remember, you cannot cherry pick your inspection data to only include data from certain inspectors or certain areas. Another thing is to make sure that your inventory is correct. Did you include the correct facility types? Is the facility information accurate? Are they properly assigned? Are they open? Are they under any legal notice? If you decide to assign risk categories, what was done per your protocol? So those are things that you need to take into consideration. So another QA aspect is training. So for data collection, think about who will collect and review your data and how will you train them. So you should consider the training and the experience of your staff. So for example, a new hire who has not completed their field training may not be ready for data collections. While there are no specific training requirements in Standard 9, you can actually use Standard 2 of the retail program standards as a good training guide. If your staff members have completed step 1 to 3 and you have signed off on them doing independent inspection, then they should have the skills to build on for the data collection process. So standardization is a bonus, but it's not a requirement. Now, after you select your data collectors, you will want to train them specifically on the data collection protocols, the marking instructions, and the data entry methods that you plan to use. So once data collectors are trained and consider shadowing a collection to ensure that there aren't questions or concerns about the protocols. Now, when you are using inspection data or your routine inspection data, it's really important that your training policies and procedures are being followed. So make sure that you have a way to assess uniformity among inspectors. So you may want to consider developing an inspection marking guide that staff can bring with them, or you can even use the marking instructions in the annex of the FDA Food Code. Regardless of the approach, staff must have the correct equipment and know how to use and calibrate them. And Justin did a great job going through that. Also, think about how you will provide QA review for the data that you are using. Do you have someone reviewing each inspection? Do you have a database that will do that for you? Don't forget to train those quality assurance checks on the data that's being entered. They need to understand your marking instruction and the methods that you are using for your study. And of course, you can always ask FDA for assistance with coming up with your QA plan. And remember, standards 2, 3, and 4 have great benchmarks for training, for risk-based inspection procedures, and ways to assess uniformity in your department. So these could be good tools to use if you're going to use inspection data. For data review and entry, you want to make sure of the following: completeness. Are forms being completely filled out? Are there missing information? Are all the information statements and data items marked? Did the data collectors or inspectors write down observations when marking things out? Proper marking. Did staff follow your marking rules? Are there any marks that needs to be followed up on with the data collection? Do they record do the recorded temperatures match the markings, right? It's important to follow up with staff and correct data points when needed. So in addition to training, you may want to observe data collectors in the field, especially new collectors or inspectors. Now, if you are pulling data from your inspection system, you will follow a similar process. However, quality assurance may also include checking to ensure that you included the correct violations in your report. If you're using inspection data, you might need to adjust your data collection procedures compared to your routine inspection procedures. Now, one thing to note about this, the retail risk factor study database that Mike will go over later is a great tool because it has some built-in QA checks already. So it will not let data collectors submit an incomplete record, and it marks the information statements based on the data items. There are a lot of quality assurance checks on the data items, and it will actually flag the collectors that they need to review an entry. So really, this makes the job for the QA team a whole lot easier. So key take homes for quality assurance, it really helps that you have high quality, accurate, and representative data for your study. QA, it's a continuous process from design all the way through sampling, collection, marking, and data entry. Again, if you use the risk factor study database, the system has many cool built-in quality assurance checks already. All right, so next, I'd like to hand it over to Alicia to cover the next section, which I believe is one of her favorites.
Yes, thank you so much, Catherine, and you are totally right. This is one of my favorite sections. First, before I jump on in, I just want to give a huge thank you and shout out to the co-presenters and team members who are helping out with this. Thank you so much for doing such a great job, Catherine and Justin and Carolyn, for fielding all those questions in the chat. If people could show them a little bit of love, that would be great. So thank you so much, guys, for being such a great team. So data analysis. One of the reasons why I love this section is, of course, you put in all the time, the energy, the work into designing your study and then going through and collecting all that data. And now you want to know what it says. So with data analysis, you're going to talk about, what your numbers are saying. And of course, you're going to interpret what those things mean. And as I'm going to cover in this section, there are a couple of tricky things that you want to pay attention to make sure that you get the accurate results you need and you don't misinterpret what you have. Now, all that said, there are many tools out there that you can use for analysis, from Excel to our risk factor study database, all the way up to really sophisticated statistics packages. You don't have to make things complicated, particularly if you're just sticking with the basics for Standard 9. But if you want to go a little bit more in depth, it might be worth looking into some different types of software. But in this section, we really want to stick with the bare minimums for your analysis and highlight some key steps to ensure that you do it the right way. But first, let's go ahead and just remind ourselves of what the minimum requirements are for Standard 9. So you know what, at minimum, your study really needs to do for you. You do want to analyze your data to figure out the occurrence of risk factors, and I'm emphasizing that for a reason, which we'll come back to in just a moment. And then you want to use that data to do something, right? You want to develop an intervention strategy to reduce those risk factors over time. And then, of course, you're going to evaluate those intervention strategies in a future risk factor study or using another method. And kind of a big part of Standard 9 is being able to look at trends over time to see where things are going, if we need to reanalyze, pivot, do something different with our programs. The other thing I want to bring up, and you guys have seen a table like this before already in this workshop, is to really remind ourselves about how we're measuring the occurrence of risk factors. So we can't directly look at poor personal hygiene. Instead, what we do is we observe behaviors and practices related to the control of poor personal hygiene to get an idea of how that risk factor is actually happening in our establishments and in our community. So looking at this table, I just want to remind folks that when we're looking at poor personal hygiene, for example, in order to get an idea of what's happening with that risk factor, what we're really doing is using the data from both data item 1 and 2, so due to two different areas of behaviors and practices, to get an idea of what's happening. And so for a lot of our risk factors, we're going to have more than one data item. Now, for those of you who are leaning more in the direction of, I think I'm going to use some inspection data to make this happen, that's okay. As I go through this section and I say the term data item, I want you to also just think violation, because the approach that we use for data items, you can use the same approach with violations when you're analyzing your data. So one of the things that we talked about earlier when I did the study design section, and Catherine mentioned it a little bit later, is it's super important to collect your data using in, out, NO, and A types of marking. And the reason why is because you don't want to skew your data. When you're thinking about different things that you look at during an inspection, so for example, cooking or cooling, when you come in, maybe that facility isn't doing it at the time of your visit, or maybe due to their food flow or process, it just doesn't work, right? It's not something that they typically do. Your inspectors need the ability to mark NO or NA to show that they didn't actually have the ability to make an observation. And the reason why that is very key is this slide right here. So let's say, for example, we do 100 data collections and we're taking a moment to look at what our findings were for cooking. In these 100 data collections, we were only able to observe cooking as either in or out in 80 of the facilities, because 5 don't do cooking based on their food flow and process, and 15 weren't actually cooking foods at the time of the visit. However, we did mark 60 facilities out. Now, at first blush, when somebody's thinking, oh, percent out of compliance, that's our percent out over our total number of facilities, that would give us a 60% out of compliance. However, that's including all of the facilities where you weren't able to make an observation, and those really should not be factored in. So what we need to do is take a look at the equation that I have toward the top of the screen. You want to take your total number of out of compliance observations for the data item over the total number of opportunities where you made an observation as either in or out. So when we make this adjustment, as you're going to see, it does make a significant difference. So in this case, for our example, we have 60 out observations over 100 minus the 20 not observed, not applicable markings, and that actually gives us a 75% out of compliance. So as you can see, making the calculations correctly can really determine not only the accuracy of your data, but it might actually influence the type of intervention that you're choosing, and it certainly could factor in to the way you're able to track trends over time. The other important thing that we want to talk about is how to interpret the out of compliance percentage. Big thing, it's a proportion, it is not a rate. So you can't say, for example, if let's say in a different industry segment, we got a 50% out of compliance percentage for cooking. We can't say that 50% of our temperatures were out based on this number, or that it was out 50% of the time. When you get an out of compliance percentage of 50%, what that really means is that in 5 out of 10 facilities, or 1 in 2, if you want to reduce that fraction, where you were actually able to observe cooking, it was seen done improperly at least once. So very important that you interpret that finding correctly. It's a proportion, it's not a rate. So I want to go ahead and take a beat and make sure that everybody is picking up what I'm throwing down. So I want to go ahead and give folks a chance to calculate an out of compliance percentage for hot holding. And in this instance, we have 100 facilities. However, 15 facilities, we weren't able to make an observation for hot holding. In 25 facilities, it wasn't applicable, and we marked 30 of the facilities out. What do you think would be the out of compliance percentage for hot holding? Go ahead and drop your answer in the Pathable chat. All right, I'm seeing some folks answer. That's excellent. Yeah, let's go ahead and take a look at this and walk through it together. So as I mentioned, we had 30 facilities where we marked it out. With the 100 facilities that we had in our study, we had to take out those 15 not observed and the 25 not applicable. So what that means is we have 30 over 60 or 50%. So great job on that, everyone. Now drop in the chat for me how you would interpret this result. Okay, 1 out of 2, I'm seeing that. and we're going in the right direction, absolutely. So remember, it's a proportion, it's not a rate. So what that means is, with our finding of 50% out of compliance, that means that 3 out of 6 facilities, or again, 1 and 2, if you want to reduce that fraction, where we were able to observe hot holding, we observed it done improperly at least once. Good job on that. Yes, remember, proportion, not a rate. Now we're going to move into how to figure out the risk factor percent for out of compliance. And there's a little extra step you got to do with this, but it's along the same principles as figuring it out for the data items. Again, I'm bringing this chart up so we can see how things relate to each other. And I'm going to use an example with poor personal hygiene since it's right at the top of our slide. So again, note that there's at least one data item, or if you guys are using inspection data, there's going to be at least one violation, right, that measures behaviors and practices that link to those foodborne illness risk factors. And in order to figure out if a risk factor is out, you have to figure out if the data items together would determine if the risk factor is out. Let me give you an example. It's a little easier to walk through. So like I said, we're going to take poor personal hygiene. And let's say in this instance, we had a facility where people were doing a great job of washing, as Janet said yesterday, their dirty, stinking, nasty hands. They were doing it properly. They were doing it when required. So we marked that as in. However, we noticed that food employees did bare hand contact with ready-to-eat food, so that was marked out. Since on this visit, we marked at least one of the data items related to the risk factor of poor personal hygiene is out, the risk factor itself is out. Same thing, if both of them are out, we'd mark the risk factor out, but if both of them are in, then the risk factor would be in. So when you start looking at risk factors, you need to take into account all of the data items or all of the violations that you use to measure the risk factor as a whole. So when you go to measure the risk factor percentage, what you'd need to do is take a look at the total number of out of compliance observations of the risk factor over the total number of observations you were able to make. So what that means is, if we did 100 data collections with poor personal hygiene, we did 100 data collections, and we marked poor personal hygiene out 67 times, we'd have 67 over 100. And note that I did include the 0 not observed, not applicable. You'd still need to take those out, but if you look back, with poor personal hygiene, you have to make an observation as in or out, so we didn't need to worry about it for this particular risk factor. However, for ones like, let's say, inadequate cooking, where maybe cooking and reheating doesn't apply to that facility, you might need to make some adjustments to that denominator to ensure that you actually capture the facilities where observations were made. All right, so trend analysis. This is a really exciting piece. So you go through, you do your first study, you repeat it within another 60 months. And at that point, you're probably itching to figure out what direction things are going. However, you got to pump the brakes a little bit. And while you're able to use that second data collection to maybe assess the intervention strategy that you implemented, in order to do your trend analysis, you have to wait for your third data point or your third risk factor study. That's important. When you get to this point, you may want to reach out to a statistician to help you out with the statistical analysis, unless you have somebody proficient with data in your department. And then if you get to your fourth, your fifth, or maybe even your sixth risk factor study, you can add those data points and rerun your trend analysis. However, a very key thing to remember, if you shift your study design, if you shift the way you sample, you're going to want to talk to a statistician first, because you might be comparing apples and oranges and throwing that into your trend analysis when it's not appropriate. So never hesitate. Reach out to your statistician. They're an excellent resource. If you don't have one, maybe there's somebody that you can consult with at a local university, or maybe somebody in a public health network in your state. The other thing that I want to bring up when it comes to looking at your data, don't overanalyze it or read too much into it. Be very cognizant of the limitations of your study design setup. The confidence level and margin of error are also very important, because remember, your confidence level and margin of error give you an idea of how representative that data actually is. So make sure that you keep those things in mind as you work through it. So some key take homes with data analysis. First things first, your out of compliance percentage should not include your NO or NA markings. Very key. You should only work with the number of outs over the total number of observations you were able to make as in or out. The percent out of compliance is a proportion. It's not a rate. Make sure that you interpret that one correctly. Trend analysis requires 3 data points, so you got to wait till your 3rd data collection to begin that trend analysis. Make sure you understand the limitations of your data and don't hesitate to reach out to a statistician. All right, well, we are well ahead of schedule, and I want to congratulate everybody for staying nice and engaged and keeping up with us in the chat. If we could, Mr. Justin, get, let's say, 20 minutes on our break clock, and then we'll come back up at the top of the hour, and at that point, we will bring in Mr. Mike Nordos to give us the demonstration of the database. All righty. Well, hopefully everybody is coming back from break and that you have enjoyed the workshop so far. We're moving away from the core workshop elements into that demonstration piece with Mike Nordos, member of our retail food team. So I want to go ahead and turn things over to Mike. Mike?
Yes, thanks, Alicia. Hi, everyone. Thanks for coming back. I'm Mike Nordos. I'm a retail food specialist with the Food and Drug Administration. I normally work with the states of Iowa and Wisconsin. One of the things I do as a behind the scenes job is I co-lead the risk factor study work group. So today I'm going to bring it home by doing a live demonstration. It's going to be live, no slides, so hopefully everything goes smoothly here. But I'm going to be demonstrating our risk factor study database. So the Food and Drug Administration obviously is very interested in helping everyone and building your capacity to conduct your own risk factor study. And some of the hurdles that we know local jurisdictions have to get over in doing this is having a secure place to store your data, having a way to conduct the data collection, the forms, and as well as doing an analysis, doing some of the reports and things. Not everyone has a biostatistician handy like we do. So a few years ago, we decided to release the same database that we use to conduct our study to all our local, state, territorial, and tribal partners so that you can get an account and use our database to conduct your own risk factor study and have a secure place to store your data that is only accessible to you and anyone you want to allow to see it, and that will help you run reports and do all the things necessary in meeting Standard 9. So I will share my screen here and show everyone that database. All right, so let's start out with how do you get to the database? If you go to, this is our landing page, it says retailfoodriskfactorstudy.net. So this is where you want to go if you're interested in getting access to your own secure database. If you need help, you can always contact your retail food specialist. And I promise I won't say that anymore during this live demo, except for to say that anything I show you today, your specialist has access to and can show you in more detail. Because of all the bells and whistles and everything that's been built into our database, this isn't going to be a step-by-step, user's guide on how to use a database. It's going to be more of an overview on the capabilities of the database so that you can see if it's something that would be valuable to your agency. So you simply go on to our landing page, you click register, and it's going to bring you to a second page, which lets you either contact your specialist or download a PDF. If you click here, you'll download a PDF. And what that is going to do is you fill out this form and you send it back to your retail food specialist, and they will get you access to the database. This is just a way for us to make sure that it's our actual jurisdictions who are requesting access to use this. So it's just one of our security methods to make sure people who are supposed to be getting databases are the ones who get it. So if you send this form to your specialist, they will send it to the database developer who will get you access. You will then get a welcome email with a first-time login instructions and temporary password, and you will be set to go after that. So once you receive that email and you do your first login, you'll from then on be able to access your own database. So I'm going to show you what that looks like now by signing into the live version of the database. So when you come up and you sign in, you probably won't see a screen exactly like this, because for most jurisdictions, you're only going to have one database. Because I do a lot of work in the development and with some other jurisdictions, I have multiple databases. In 99% of the scenarios, you'll just have your database will come up here. So I'm going to log into our demonstration database that we've developed. And this is what your home screen will look like. So I'm going to go over some of the functionality of this screen and help you learn how to navigate through some of the features. Now, I'll point out that when you log on for the first time and you select that database as I just did, you're going to have a just-in-time training pop up. So almost everything I go over today, there'll be one of those just-in-time step-by-step trainings that you're probably all used to whenever you download a new app to your smartphone or whatever. The first time you open it, it kind of says, click here to do this, and you have to click on that. So it will help you navigate and get started with some of the things like adding new members and where to go and how to add a report. If you're one of those people like me who are impatient, you don't like those type of forced trainings, you can opt out of it. But I just want to make you aware that that's a feature I can't show you today because I'm not new to the database. But when you log on, it will be there. So over on the left blue panel here where you can see my cursor, you'll see the first tab here is my jurisdictions. That brings you back to a similar page to what we were just on. Again, yours will probably just be one. There are situations where we've set up where you can, and I'll get into this in more detail later, but you can have access in different capacities to other people's databases and their risk factor study if they've chosen to give you access to that. So this is a secure database. The FDA can't see your data. Nobody else can see your data unless you give them access to it. But there was a need for jurisdictions to sometimes be able to get assistance from a mentor or to have another jurisdiction or someone view their data. And there's different roles, and I'll explain those as we come up in a little bit, and you can limit the roles of those people who have access to your group. But there may be times where you want other people to have access to your group. So we've developed that capacity into the system. So that's what this page is. It's just showing different access to different groups. The little plus sign here is a request access. So if you wanted this is a list of people who already have their own database jurisdictions set up within our system. If you wanted access to any of these for some reason, you could request access, and they'd have to grant it to you before you were allowed to see it. And this could be a way to find your own internal database for your members. So I'll go over in a little bit how to add members. But if you have staff members that for some reason you're having problems adding, they can always find you as well using that feature. And then just like most of the Food Shield sites, there's a directory for contacts that you can search. And you can use an email inbox and talk to people within your group for the risk factor study. So having showed you that navigation page, it brings up one of the first subjects I want to talk about, which is this is part of Food Shield, but separate. So we have our own servers, and there's multiple servers, and I will make sure I answer any questions at the end here. Because this is a live demonstration, I can't split my screen to keep all the questions up on the separate screen because it'd be too small. So I'll get to all the questions at the end here. So this is part of the Food Shield. So in order to use the risk factor study database, you first must be a member of Food Shield. So log into Food Shield, create a membership. Then when you go on to log into the database, we can get you set up with a database. Same goes for all your users. They have to be a member of Food Shield in order for us to find them and get them access to the database. So I'll explain that in more detail as we move on here. There's so much to this database. It's hard to kind of show you in a flow without getting a little ahead of myself. So don't worry, I'll come back and explain everything in more detail in a second. I just want to hit some of these features right off the bat. So let's go back up to that first tab, which brings us to our different databases. And I'm going to go into our demonstration and we'll visit the group. And again, this is the landing page for what your database would look like. So I want to go over each of these navigational tools at the top, but I'm going to start with the one on the right, which is the administrative function, because one of the first things that people are going to want to do when they are set up with their database is add members, right? So let's go over what your administrator can do. And I'll go over roles, like I said, in a second, and role meaning the different capacities and usability of the system. So if you are a retail risk administrator, you have full access to the entire system. You're the person who's going to want to add members. So this tab here shows all of the functions that the administrator for your work group or your data collection group can use. And one of the things you'll see is there's been a lot of redundancy built into the system. There's more than one way to do most of these things. For instance, you could go into group settings and there'll be a tab there where you can add members. But it makes the most sense to go to the group membership and manage that. So if you click on that tab, you'll see a list of the current members who have access to this database. All you have to do to add a member is you click on the add member and you do a search. Now, again, this is going to search members of Food Shield. So they have to have a current membership of the overall Food Shield system in order for you to add them as a member to your database. So let's just say Nelson, because I'm sure there's going to be a lot of Nelsons out there. If you know their name, you can search by them by their exact name, but I'm just going to be brief. So you can say, I just pulled up anyone with the name Nelson who has a Food Shield account. So if I wanted to give them access to my database, it's as simple as selecting a role, which I've alluded to a few times over here, or previously, and that's over here on the right side. So I'm going to take a break here and I'll talk about the roles a little bit. So I'm currently in the role as an administrator, and the person who applies for access to the database will be set up as your administrator. It's a good idea when you fill out the application to have a second person's name on there because they'll be set up as an administrator as well. It's just a good idea to have two people as administrators all the time in case one person forgets their password or they, who knows, maybe they quit your agency or whatnot. It's good to have at least two. It's not good to have everybody be an administrator because, as you'll see in a little bit, they have full access to the entire system. They can change the data collection form. They can edit other people's data collections. They have full access, and we'll go over some of that and how they do it in a little bit. A data viewer is just what it sounds like. That's a viewer. That person can't really do anything except for view your site and the data that's been entered. They don't have access to make any changes, and they don't have access to enter data collections. They can just view. So that's a situation where if you wanted to allow a mentor access to your site or another jurisdiction for some reason, just to see what's going on, you can make them a data viewer. And they can't enter data or anything like that. And the last is a member. And the member role is going to be your basic role for most of your employees. The member can go in and they can enter data collections and they can view and edit their own data collections, but they can't view and edit anyone else's data collection. And they can't make changes to the overall work group rules, and they can't make changes to the data collection form. So that's kind of like your inspector role is the member role. So what you would do is you would select the person that you want to add, their role, and as soon as you click on it, they are added. And that's how it's as simple as that. You find them, select their role, and they're in. Let me go back to that page. I'll go the long way so you can see how I did it. Once people are in your work group, managing your work group is pretty simple. You can see this is a demo database, and all of your retail food specialists and some extra people have been added on here. That's for purposes of displaying and demonstrating the database to all our local jurisdictions. So everybody in this one has been assigned an admin because we need to give them full access so they can do everything. If I wanted to be mean to Catherine, since she's co-hosting with us today, you could edit roles. I could remove from the group or remove their administrative rights. And Catherine, I promise I'll change you back later. So it's as simple as editing their roles, take them off of administrator, save changes. Now they are just a data viewer. So that means that she would not have full access to the site anymore. So let me change that back before I forget. So that's how simple it is to manage roles of everybody using your database. Let's go back to jurisdiction admin. Again, this admin tab is only available now that I've explained the roles for the one or two people or however many people that you've assigned to be your database administrators. The group analytics is kind of a cool feature. It's just the beta feature. All that's showing is the number of users, how many times they've accessed it in the past however many days. So you can kind of see who's using it, who's entering data. I'll go over reports at the end in a lot more detail, so I'm not going to use the reports function from the administrative tab. Like I said, there's redundancy built in. This reports tab under the admin brings you to the same thing as the reports tab on the top in the navigation bar. So we'll be going over that at the end here when we go over that part of it. But let's talk about customizing the data collection. So we spent a lot of time today looking over the forms. We said that you could customize some of the forms, include features that you want or don't want. So when you originally log on and you first become a database user, you're going to be set up to do the exact same data collection that the FDA is doing. So you're going to have not only those primary data items of 1 through 10, but you're going to have all of the secondary data items listed as well, including some of the key correlations and all the other data that the FDA is collecting. So what I mean by that is the FDA has designed our study to make some key correlations between food safety management systems, certified food protection management, and the occurrence of risk factors. If you don't want to make those correlations, you don't need to collect all the data on that. You can opt out of collecting the information on food safety management systems and some of the extra questions that do that. The thing is, if you do that, you can't run the reports on it, obviously. So you can only run the reports on the data that you collect that's in there, but we understand, time and resources of everybody is different. So if you don't want to do some of that extra stuff, it's up to you and how you enter your form. So the way you do that is here. There's two ways. You'll see customize form sections and update enter default responses. The enter update default responses is slightly easier. So I'm going to go over that first. You'll see what this is just you can enter answers to some of the questions on the data collection. And you enter it one time and they'll automatically populate every time you enter them. So why would you want to use this? Well, when the FDA goes out, we're collecting lots of data on the jurisdiction, whether they're enrolled in standard 1, what type of grading system they use, do they require posting of the inspection results, just all kinds of different information that we're seeing if it makes an impact on the occurrence of risk factors. So if you want to include this in your study, but you don't want to have to take the time to fill this out every time because it's not going to change because the answer is the same every time for your jurisdiction, you just fill this out one time and it will auto-populate on every data collection that is entered, and your staff doesn't have to take the time to answer those questions. The answers will be there. So that's the update enter default responses. Let's go back to the customized form selections. There's two ways to customize your data collection form. You can do individual questions or whole form sections. So now, you cannot take out questions or sections for the primary 10 data items, nor data item 17, because as we learned earlier today, those are associated directly with your 5 risk factors. And to meet standard 9, you have to assess the 5 risk factors. So the primary 10 data items and data item 17, which is source, have to be included when you do your data collection. Other than that, you can customize the form to include, exclude things either by the question or by the whole form section. So you'll see here, we asked lots of questions on what's going on in the establishment at the time we're there, such as maximum employees per shift, if they're busy, activity level at the time, the average numbers of meals they do today, depending on the industry segment we're in, you might ask for number of beds, if it's a school. All these questions aren't pertinent to every data collection. In a little bit, I'll show you how this works, but when you load your data collection, it will load the appropriate form. But in this section, you go over every question that could be on every form and you say whether or not that's something you'd want to collect data on. So you can see there's 3 pages of those. I'm not going to go over each one. Just know that that's one of the ways that you can customize your own form and your own data collection to make it as simple or as complex as you want. At the same time, you can just simply exclude entire sections by clicking one of the radio buttons here on the right. So if you don't want to collect information on the regulatory authority, which I had just shown you under the update enter default responses, maybe you don't even want to do the default response. You say there's no reason to have that at all. You just simply exclude that from the form. and you've customized it and it's set now, so it won't appear on your data collection forms. And you can do that for any of the sections, such as the Certified Food Manager certification, that's number 4 here. That's that correlation I was talking about on the level and presence of a Certified Food Protection Manager in order to make some of those correlations. But if you don't want to collect that information, you can exclude that. Again, be aware that if you exclude it, there's some other reports that won't be able to pull that information for you. All right, so that's how you customize the form. That's all there is to it. It's pretty simple. And everything else on here is pretty straightforward and just redundant. So I don't think we need to go through most of that today. It's just you managing your group members. This should look the same as the rest of Food Shield. So let me go back to my home page and cover some of the other things on this page. We'll go over ad record in a little bit, but let's go over the submissions. So again, in the administrative role, you have access to view or edit all the data collections in the system. So if you're an administrator and you hover over the submissions, you're going to see my submissions and all submissions. If you're a data viewer or a member, you're not going to have the all submissions because you won't have access to see other members' data entries. You can only view and edit yours. So let's start with the my submissions. So this would be something that everybody who is a member has access to view. And again, this is all fake information. This is just a demonstration database, so these aren't real places. I entered this first one, Mike's Slop House, that's me. So when you go to the My Submissions, you will see all the data collections that you have currently entered. And this is a running list from everyone you've ever entered. You'll notice on the left side, there's an edit and a view. So what the view is, if you click view, it will simply open up that data collection in view mode. It's a PDF and it will show you all of the answers in the data collection in a paper form format, okay? It's a safe way to enter it. You just enter it, look at it. Maybe you wanna make sure you entered something right or were consistent or you don't remember something, so you just click view. If you click edit, that's gonna open up the form into edit mode, in which case you can make changes to the form. The reason that we have 2 different toggle switches here is we have some amazing quality assurance built in to our system, which I'll show you when we get into the form and how to fill out a data collection. But if you click edit, that opens up the actual data collection form to make changes. And now, before you can close and save that form, you have to pass a quality assurance check, where it reruns this check and it may make you answer questions or fix changes before it will save it. And I'll go over that in a little bit so that makes sense, because that's a pretty cool feature that we've put into this. It's a huge time saver and adds a lot of the quality for your data collection. But again, I don't want to get too far ahead of myself. So you'll see on this page, most of mine has been entry started. So what that means is I went in and I started to enter the data collection, but I haven't finished all the fields yet, so it hasn't saved. You'll see that I've only completed 1 data collection. What the word completed means is that I've gone in, that data collection has passed the quality assurance check, is saved, and now when I run a report, it will pull data from this report. So if I have not completed it and it hasn't passed our quality assurance check yet, that data won't be pulled when you run reports, which you'll see in a little bit. The reason that's important is because we want you to pass that quality assurance before that data is part of your study and the reports of your study. There's a few more statuses that I'll show you in a little bit here. I just can't show you from my screen because I haven't entered enough. So let's go to the all submissions. And what this is going to do is, this again is the administrator role, and it's going to show you every single data collection that's been entered into your database. It's not going to take 2 minutes because there's not a lot out of data in this demo database yet. And I will tell you that one of the things that DataStream Inc., who is the developers for the database that the FDA works with, has done well is there's multiple servers running our databases for us. So when you click to run a large report, there's an exchanger in there that sends you to the server that has the least amount of traffic, so we run our reports pretty quick. So what you can do is you can filter down to see per industry segment which reports you want to pull. I'm not going to do any of these filters at this time because there's not a lot of reports in the demo database. You can sort by collection date. I'll go over all this in more detail when we actually run a report. Right now, I'm just as a reminder, I'm just looking at all submissions. So all I want to do is see all the data collection that has been entered. As a manager, I might want to see who's doing what, and I might want to do some checks on their things. Anytime you do anything, you can always see the data on screen, or you can download to Excel. Sometimes it will be a PDF instead of Excel. I usually start with seeing data on screen. You can always download to Excel later. So you'll see there were only 64 records there. It showed you pretty quick. Let's view more. So now you'll see Penny was someone who worked for University of Minnesota and entered some data in here just for testing purposes. So now I'm not only seeing mine, I'm seeing everybody's data collections because I have that administrator. You can go across and you'll see that it tells you the industry segment that you're in, because I didn't sort between segments, who the data collector was who actually did it, and some more general information on the place. Okay. So again, over here on the status, I was going to show you a couple more on the status. So I'll toggle these arrows at the top. You can always sort as you go through, just like you would be in Excel, or you can go up here to the right, and you can download this whole version of what all this data to Excel, and you can sort using any of the Excel features that you like. So if you're one of those data gurus who is really good at using Excel, anything that you can do on Excel, you can do with this data by just downloading all of it into Excel. We're just going to stay here on this screen. So you'll see a couple more statuses here. Updating means that this person has gone in and they've made changes. So they hit that edit button, but they forgot to resave, or they didn't pass their quality assurance check. So that data is still updating. So before this data is included in your study, either you or the person who entered this data collection would go in and need to resolve some of the issues that might be pending. Failed validation means that this person entered a data collection and it failed the quality assurance check. So again, it needs some things fixed that you'll need to go in and look at, and I'll show you how to do that when we get into the actual report. So that is all there is to the my submissions and all submissions. Let's look at adding a record. Actually, let me bring you back to the home screen first. We're going to leave this page. So again, there's a couple ways to do everything on this database. You can go up to add record here. Your my submissions, that screen that we were just on, under the my submissions here, I could click this tab and that'd bring me to the same thing that we just saw, or we can go and add a record. So once you've got your people in here and your form is set, they're going to want to start adding some data so that we have something to run our reports on, right? So you click on add a record and this first screen is going to come up. And I'll go over the navigation bar here in a second, but I wanted to jump down first real quick and go over this industry segment screen, because what this screen is doing is it's loading the correct form. So you have to tell it which of those inspection forms you want to use depending on the industry segment you're in. And then you also have to tell it what your food safety management system is. So let me pause there real quick. The food safety management system assessment is one of those correlations that I was talking about that the FDA is doing that you can choose to incorporate or not incorporate. So if on that previous screen that I showed you under the administrative tab, where you can select whole form sections, if you selected to opt out of doing the food safety management system, this won't show up. If you want to keep that in, it shows up. And what that is it's saying for each of the data collections that you're doing, we're going to have your data collector randomly, the system will randomly select one risk factor that you're going to actually do an actual food safety management systems assessment on. So for the FDA form, it's automatically enabled. So it's going to require us to select that. So for this one, we're going to say that for personal hygiene, which is data items 1 and 2, is randomly selected. So that's the one we're going to select, but you can see you can select from the others as well. Industry segment is going to assign the segment that you are randomly doing. So we'll say this is a restaurant. And now the FDA has broken down restaurants into 2 categories, fast food and full service. So we're going to say this is a full service restaurant. So now we're set. It's going to load the form with the appropriate questions for this industry segment and food safety management system. So you can either save the page or save and go to next, and you'll see you get a warning that you're attempting to navigate away. All this is saying is that you're now loading this form. So if you made a mistake and you're like, oh, this was supposed to be a healthcare form, you have to delete this form, go back out, enter a new data collection. So it's just giving you a warning that it's loading the forms. Once the questions are loaded, they're loaded, and they have to stay because of quality assurance. I'm not going to go over the entire data entry for you. You just saw the form in paper version, and it's the exact same form in the paper version. The nice thing about this form is there's quality assurance built in all over it. So if you remember the rules for how to properly mark a data collection form, meaning if it's in, it has to be in, unless there's one out, then it has to be out. All those rules are automatically incorporated into this system so that your data collectors cannot make a mistake on the rules. So they can't, for instance, say something is in compliance for cooling and not enter a cooling temperature. It's going to say, if you made this observation, there should be a temperature. What is it? And it will make you fix that, or you're going to get that error that I just showed you that said failed validation. So lots of quality assurance checks in there. It goes all the way to the hand washing assessment. You can't mark that you a number on your hand washing assessment and then say you didn't observe hand washing, because it's smart enough to catch that error. Just as, and the same for any data item, if you have something marked out, for instance, you can't have the overall data item marked in. If one of the elements within that is out, the system knows that it has to be out, so it's going to ask you to correct that. So just a little plug for the quality assurance on there. That was a huge time saver for when we had to go write the reports, because one of the biggest delays in getting the FDA study final report out there was doing the quality assurance checks and fixing any mistakes that had been made and contacting the data collector and seeing what they saw and making sure it was entered correctly. This system takes care of 99% of that for you. So it's pretty nice. Okay, let's go over the navigation. It's pretty straightforward. There's multiple ways to navigate and some functions here I want to show you. So the navigation button here, you'll see data collection. This is just a drop-down list. So you can jump back and forth to any one of the 19 data items within the form and enter that. So where this is nice is that within the last year, we've been working with the developer to make this handheld friendly. So at the FDA, we aren't using our handheld devices because of some of the other limitations with having internet and whatnot. But the functionality of this has been made so that it can be used on a handheld device if necessary. I don't think personally it works too well on a phone, just because sometimes it's harder to read and see, but certainly on an iPad or a tablet or something like that. If you have internet connection, it's not the type of thing you can go on and enter. At this time, we don't have it where you can go on, enter, and then later connect to the internet. So you do need, that's a limitation if you're doing this live. So anyways, you can jump back and forth to any of these areas on the form. That's one way to navigate. Or you'll see at the bottom of each of the pages, you can save the page, or you can navigate by simply going through step by step through the form. The completion status here at the end runs at QA checks. So everything within this form, and you'll see the progress at the top, we're only 2% complete. So as you complete the form, there's this nice progress bar at the top that shows you how close you are to finishing entry on that data collection. Status button, I'm not going to hit right now because that's going to run the QA check. And since I haven't done any entry yet, it's going to have a whole bunch of flags on there. Form, what the form does is that will download a PDF version of this form. So if you need for some reason to print the data collection form, you can do it from there. Instructions is a complete set of the marking instructions. Again, that's going to pull up a PDF, and exit just brings you out of this data collection. Next to every single one of the questions here, you'll notice this blue little icon with a little eye in it for information. What that is going to do is it's going to bring up the marking instructions pertinent to that data collection item. So if you're out in the field or your data collector is marking something and they're not quite sure the proper way to assess that as far as being in or out, or maybe they're wondering if that's part of the study, because not all items in the food code are part of the data collection, right? So if you click on information, it will pull up the marking instructions for that item. And I'll show you one that's a little more complicated. The data obviously doesn't require many instructions because it just shows you what you're entering. So everything's been set with radio buttons so that you can just click the button and it will drop down menus so you can select who the data collector is that you want to do. Time in, time out in military time, and the risk categorization. And then you go next and it automatically saves that page and goes to the next where you enter your information on the establishment name and go through each section. So I want to show you some things that are interesting. Remember, we selected the Food Safety Management System 1, which is going to be for personal hygiene, right? So we're going to look at hand washing and no bare hand contact. Data items 1 and 2 are where we told this form to load our food safety management systems. So if you include this in part of your study, you're going to see that hands are clean, properly washed. Say, yeah, they were, but they weren't done properly, out. And just a reminder that this is, you can look at how to mark this. So here is a better example of that marking instructions. It brings you to exact wording within the FDA marking instructions. It tells you the code references that are applicable to this being in or out. Sometimes there's a long list here, right? Especially when you get into the supporting data items that aren't our primary 10, there's going to be more things within that data item or more codes that you're assessing. So they will all be listed there. And just a quick little tutorial on how to properly mark that. You'll see the hand washing frequency assessment. So we have chosen that, yes, we're going to include that in part of this. So that's where you say how many times you saw people doing, let me get my numbers lock on, washing hands correctly or incorrectly. And then your food safety management system assessment is, you know, this place was very well developed. Even though they weren't washing hands while I was there, their systems were in place because we're assessing that independently, right? So just an example of how you do that. We'll save and go to the next page and you'll see the same thing on this page. Now you'll notice that it hasn't run a quality assurance check on there. I didn't even look at what I was doing, but I imagine I entered some things wrong because I entered some numbers of people doing improper hand washing and failure to wash, but I selected in for hand washing. So the quality assurance check is going to flag that and say that can't happen. You saw it wrong. So either you have to mark it out or you have to mark it in and then say a 0 for people who did it wrong. So bare hand contact, we'll say is out, and their procedures weren't developed. So that's how you do that. And it's gonna do all the math and everything for you behind the scenes when we run our reports. And I'll show you that in a little bit when we do our reports. And you'll see that now I'm actually 26% into it. So that's how the food safety management systems work and the assessment of hand washing work. Another feature is for any of the risk factors that require a temperature observation, so hot holding, cold holding, cooling, and reheating are going to allow you to not only enter what you saw, such as in compliance for food being, what am I on, cold holding for cold holding food. We have a chance for you to enter what you saw. So let's say we saw cooked chicken. And there is spell check on this. So for people like me, if you spelled chicken wrong, it's going to catch it. So that's always a nice feature. Of course, I spelled it so wrong, it didn't know what it was. There we go. You enter the food temp. It was at 45 degrees today. Our limit was 41. Some things have different food code limits, right? So you have a choice. And it even tracks the type of cold holding unit you were using. So this was ice on food. So you can save and add another or just save. So some of the neat features that this is doing, and again, I entered in compliance for this and I just entered an out of compliance temperature. It's going to flag you in your quality assurance check and say, that can't happen. It's also going to flag me in my quality assurance check that I didn't enter 2 of these responses and they need to be entered. And that's a good time for me to pause and tell you, just because I just thought of it now. If you select a response for this other category, which should almost never be used because we have the system pretty well set up to cover every situation you need within the questions. If it's other, it's usually not applicable to the data collection as the parameters we've in the FDA set up. But if you were to enter an in or out or anything besides not applicable, it's almost always going to be not applicable. But if you're to enter in, that QA check is going to make you enter a comment there of some type so you can explain what you saw that you think is part of the data collection that didn't fit in these above marking items. You can also use these comments anytime you see an item out up here. So let's say we saw something out and it was eggs. You can actually type in here, you know, eggs found at room temperature. So you can enter comments just so when it goes to quality assurance or whatever, or for your own memory. This is extremely helpful when assessing cooling, because a lot of times cooling is a harder thing to assess. And someone will say, well, how do you know that was out? You can say, well, it was found cooling overnight or whatnot. So comment section is good. It's not required unless you do one of the others, then it is required. All right, back on track. So I just entered cooked chicken. That temperature is out. If you thought you did it wrong, you can open and recorrect, or you can just delete it here. So once it's entered, you can always fix it. You're never stuck. And there's a cold holding temperature summary. Nothing's been recorded here yet because I haven't hit save, but you can click the button. And what it just did was it refreshed and it tells you how many degrees out of compliance each of the data items were. So if you want to know, hey, in my mind, there's a difference between on our data collections is something 1 or 2 degrees out of compliance, or is it 10 degrees out? It will make that assessment for you. I only entered 1 item, but you'll see it's here. It was 3 to 4 degrees above the food code critical limit. So it smart enough to know that. And lots of assessments available that you can do on that type of thing. And again, similar type of drop-down menus are for anything that has to do with cooling or any of the temperatures. So you'll see that it's not there yet, but don't worry, as soon as I say either in or out, meaning I made an observation, then that pops up so I can start entering some of the cooling. So that's all there is to entering a data collection, and you just save and go to next, and it takes you through each page of the form and you enter your data. When you're done with your data collection, if you were to exit it, just save the data. But I want to save this because I'm ready to move on to the next one, and I need it to be part of our report. So I'm going to hit status, and boom, there's my quality assurance check. It brought up everything on the data collection form that I've done wrong. So you'll see that I just not entered some information at the time of the inspection. I didn't enter any of the establishment information. Here's that hand washing. It tells me I marked 1A in, however, I entered 1 or more observations under that assessment as being out. So it's telling me I have to go back and fix that. And it will simply hit fix page issues, and it will navigate you right to the page that had an issue, and you make the fix according to what you just saw. That should have been out, my bad. Save that page. Now when I do my status check, hand washing isn't there anymore because I fixed that problem. Looks like I have a lot of other stuff I need to fix before we pass, but we're not going to do that today. All right. If you're ever halfway into a form, this is a common question we get asked, and you're like, oh, I totally messed this up. I just have to start over or whatnot. You need to delete a data collection. You can always do that. It's only available on the very last page of the data collection. There's a submit full response or a delete button. So you click delete and it's going to delete this data collection. Submit full is going to run you through that QA check again. Didn't pass. So I get a not validation, and that's telling me I have to go run that QA check. So, all right, let's exit out of the form, and I'm going to show you our reports. Reports is a function that only the admin can do, and this is one of the coolest features of this system. So I have to leave this data collection page. So again, at the top navigation bar, I just clicked on reports, and you'll see right now we have our reports divided up by industry segment. This is going to go away pretty soon, and it's just going to be one reports page with all the reports listed, and you'll query which industry segment you want to look at. So I'll tell you right now, our reports will run almost everything that the FDA does for you. You can do all those food management system reports. You can look at your primary 10 data items in and out. I'll go over some of these here in a little bit as we run through this. The thing we're working on that you heard is, in order to assess trends, you need 3 data collection periods over time. And as you saw when I did the all submissions, is everything runs together, right? Every data collection you've ever entered is under the all submissions. In order to run reports for specific data entry periods, you query those out by using the date function. So I think I have time, I can show you that. Well, actually, I'll show it to you in the reports. It's basically the same. So you query between data collection periods by using the date functions of before, between, or after, and you'll see what that looks like when I run one of the general reports here. We are in development right now of having the system be able to run a report that does the trends analysis for you. So you'll be able to tell it, I want this data collection period, and you set the dates to compare it to this data collection period with the dates and assess the trends for me. It's quite complicated to do. The developers told me it's a big ask on our part. So we're spending most of this year working on that. So hopefully by next October, that will be part of the system. But for now, these are the reports that we have that you can run. Very helpful for meeting standard 9. You'll see the report 1A right off the bat is that in and out observation for our primary 10 data items. So this is that assessment that you need to meet standard 9. It's going to tell you, as we saw, how many times you saw something that was in compliance, meaning they did it at least one time right, as Alicia explained, or at least one time wrong, and it will give you that report. 1B is going to do that in and out for all the data items. So the only difference there is it's getting you in and out for the primary 10, and the B is doing all 19. So we have a bunch of reports. So I think anyone who is crazy about numbers is going to find a report that does what they want to do. We have the report 3 here is doing not just the in and out, but also the not observed, not applicable. So if you want to see how many that affects the data when it's not observed, not applicable, you can run that in. You can look at you'll see report 5 is just out of compliance. You can look at just the information statements. So remember, you can break down your data when you look at it by risk factor, by information statements, all kinds of ways to look at the data. You can look at average duration. You want to know how much time your staff are taking doing their data collections. You can look at that. You can look at it in minutes. This is the employee health. So if you select to do your employee health, that's one of those radio buttons that I said that you could exclude from your study. But if you didn't exclude it, you can run an employee health report that summarizes the data for their exclusion, restriction, and all those employee health questions. Your temperature summary tables that I just went over with you, and I showed you how you can enter that. You can summarize all the observations for your cold holding, hot holding, cooking, reheating, cooling, run a report that pulls all that. Your PTM and compliance center, your food safety management system scores. So this report will show you the number of in and out compliances for each food safety management system category. So that's that correlation that the FDA makes, right? It's showing, does the level of a food safety management system have an impact on risk factors in my community? This is a brand new report that we just got working. So I'm going to run this one for you to show you what it looks like. And hopefully it's working. So when you go in to run any report, and these all look the same, it's the same as you saw in my submissions, and it's the same for any report, is you're going to run a query. You can toggle between, remember those different jurisdictions we're in, but we're in the demo jurisdiction, so I'm just going to keep it there. Right now I am in, if you remember, I'm going to go back. I'm in the restaurant specific food report. So that's something that's going to change in the future, is you'll query which one of these industry segments you're running reports on at the time, because we figure there's no reason to have them across the top since it runs the same reports for everything. So we'll go back down to that food safety management system report, type get report. This is retail, or this is restaurants. If it, in the future, you're going to select whether it's restaurant, retail, food, whatnot. Let's select both by holding down the key. This is where you can filter between dates. So you can do equals, greater than, equal to, less than, between. So this is how you get your different data collection periods, is by toggling the dates of the data and when it was entered. Because this is a demonstration database with not a lot of data in there, I want to make sure we have enough data. Again, you can see it on screen or download to Excel. We're going to see the data on the screen. And that was lightning fast for how it used to be when it was in development. So this is what it spits out. And again, there's not a lot of data in here. So it looks like there's only been, only 8 data collections that were entered where they did the food safety management system and completed it. And they were all well developed and documented. So we have 100% in compliance here. Obviously, once you get your data, it's going to have some underdeveloped and non-existent, and it will show you the in and out of compliance as well as the percentages. That is pretty cool. It does all the math for you, all the statistics behind the scene, and does those correlations. And again, it does it for this, and it does it for the Certified Food Protection Manager as well. I'm making sure we are good on time here, and I think I just about ended perfect. I've shown you all the features that you need to know to get going, all the features that are big selling features here. So I am going to close down the page here and see if, Alicia, do we want to take questions or should we do it in chat? I know we're right at the time.
Let's go ahead and do that in the chat, and then Justin can take us home.
Okay, Justin, how about you take us home?
All right, well, thank you, Mike. Much appreciated for that demonstration. All right, so let's wrap up things, everybody. So let me see, let me take control. All right, well, look, Ma, we made it. We made it through this workshop together, and which I hope that y'all have better knowledge and a general base on how to conduct a risk factor study. We know kind of on the surface level, it may seem very daunting, but with the right tools and the right resources, you can conduct a risk factor study and help gain a new perspective on how effective that your program is. So I'm gonna give a really brief recap of what we went over today, focusing on the core requirements of Standard 9, and then I'll share a few resources. So of course, we covered a lot of information here today. So let's refocus on what the actual guidelines are and the requirements in meeting Standard 9. So as a reminder, Standard 9, to meet Standard 9, your study must include 4 facility types: healthcare, schools, restaurants, and retail food stores. Keep in mind that you only will include the segments that you have direct jurisdiction over. So for example, if you don't have jurisdiction over schools or retail food stores, you don't have to have those a part of your study. We want to be consistent in the way that we tease out our categories. So if you decide you want to break those restaurants down to fast food and full service, you want to be very consistent in those different categories. And of course, you can also cover different facility types. I think there was Alicia that had mentioned if you wanted to throw in mobiles or temporary food establishments as well, you have that flexibility. This study must focus on those targeted type of assessments on the foodborne illness risk factors and use a form that captures data on in, out, not observed, and not applicable marking conventions for those risk factors. And as a huge reminder, we have a form outline out for you all, so you don't have to reinvent the wheel. You can take the tool that we have and adapt it to your needs. And then this is a slide that was shared earlier. This may sound like a lot of work, and it is, but we guarantee you it's time well spent. You'll be working to meet Standard 9, but thinking big picture, it will offer other benefits to your department as well. As previously mentioned by Alicia, you will get a representative sample of data on the occurrence of risk factors in your community. It will show trends over time and help you to make those informed data-driven decisions about your intervention strategies. They will also help you to present data to your stakeholders and help you make those policy decisions going forward. So resources, I wanted to recap a lot of the resources that we were introduced to here today. So to get us started, as a reminder, again, we have that form for you all to use and adopt. And alongside that form, that comes with the marking instructions that Catherine went over for us. This goes along with the model form to help support your data collector training, and it will help you to ensure uniform marking, and in terms helps with some quality assurance aspects for your study. Your biggest resource, of course, is your retail food specialist. I think you've heard that quite a bit today. We are here to help you all. We can help to give customized trainings, both in person and virtually. Your specialist can help you train your data collectors on the use of the form, the marking instructions, and just the overall approach for how to conduct a data collection. For those who decide to include optional assessments, we can help you with training on hand washing frequency, certified food protection manager status, employee health, or that food safety management system assessment that you can include if you decide to. For those of us who are new to risk factor studies or would like to reevaluate your approach, we can help give you some consultation on your study design and maybe help point out some things to help maximize your data collection. Program Standards Resource Center is a great tool. It goes in conjunction with Food Shield, as Mike had demonstrated. If you're a member of Food Shield, or to become a Food Shield member, it's completely free, and you can have access to the Program Standards Resource Center and that risk factor database that Mike demonstrated, but you have to have that Food Shield account first. The Program Standards Resource Center, you can get access by reaching out to your retail food specialist. And particularly, there's different folders for each of the program standards. So if you visit the Standard 9 folder, you can gain access to a lot of materials that are shared by other jurisdictions. Maybe they've shared their final reports or their intervention strategies that they implemented. You can get a lot of different type of examples of marking forms and things like that, help establish good networking contacts. We strongly encourage for those that decide to use and borrow some materials that you then turn around and share some of your documents as well to keep the community flourishing. And another great resource that we just had a great demonstration by Mike is that Retail Food Risk Factor Study Database. As a reminder, the database will provide an online secure data storage, and it can do data analysis that's quick and accurate based on the information that you plug into the system. It has quality assurance functions to cut back on some of those data entry mistakes, cut back on your resources, and help improve data integrity. It's customizable, like we saw, so you can toggle on and off different features that fit your study's goals. And just as a quick reminder, if you need access to this and get further demonstration and training, reach out to your specialist. As Mike had explained, the program managers and folks who want to have one of these, you must follow a few simple steps. You must first really outline who's going to be the main point of contact or the site administrator. Once you've sorted that out, you will visit that retailfoodriskfactorstudy.net and click register for you to gain access to a PDF that you're gonna outline who that person of contact will be, shoot that to your specialist. Once that shell database has been created, the administrator can go in and add members, add data reviewers, and customize the form like we saw during the demonstration. Lastly, Well, I would love to share some links with you that we all discussed. These should be posted on the landing page for the workshop. So there's the page for our retail food risk factor study, where you'll find information on our study and the design, the reports that we have for our previous data collection periods. You'll find the data collection form and marking instructions here as well. There's another resource here is the clearinghouse. A lot of folks may have had the same questions as you. So please feel free to visit this site, and there's some guidance given by the clearinghouse on the different standards. So if you're really concerned about something with standard 9, visit the clearinghouse. There may have been a similar question asked, and there was some guidance issued by the clearinghouse. And then lastly, this is the link to the data collection tool, that database that we just demoed. So as a reminder, we will be getting all of the questions from the chat and posting an FAQ document on the workshop page for you all to reference later. So that is all she wrote. So I'm going to stop sharing my screen and welcome our instructors back to the screen here, so we can wish you all a big thank you for joining us. And we hope that you learned a lot about risk factor studies. You left very motivated and feeling that you can conquer this, and you're not alone. That's what we're here for. We're here to help you all. So again, thank you so much. And we're all gonna bid you a fine evening and good afternoon.